having thy fair always before our eyes, and laying aside all private interests, prejudices, and partial affections, the result of all our counsel may be to the glory of thy blessed name, the maintenance of true religion and justice, the safety, honor, and happiness of the Queen, the public weal, peace, and tranquility of the island, and the uniting and knitting together of the hearts of all persons and estates within the same, in true Christian love and charity, one towards another, through Jesus Christ our Lord. Amen.
Seated, please. This Honourable House now resume its sittings. Call of the roll.
Mr. Witter, Mr. Samuda, Mr. Holness, Mr. Holness, Mr. Clark, Dr. Clark, Mr. Shaw, Dr. Chang, Mr. Montague, Ms. Grange, Mr. Henry, Mr. Bartlett, Mr. Mackenzie, Mr. Chuck, Mr. Daryl Vaz, Mr. Warmington, Mrs. Robinson, Mr. Hutchinson, Dr. Tufton, Mrs. Williams, Mrs. Malahoo Fort, Mr. Green, Mr. Terrelong, Mr. Main, Mr. R. Scott, Mr. R. Scott, Mr. Azan, Mr. Brown, Mr. Brown, Dr. Brownberg, Mr. Buchanan, Mr. Bunting, Dr. Campbell, Mr. Leslie Campbell, Mr. Pernell Charles Jr., Mr. Clark, Mr. Heroy Clark, Mrs. Malahoo Fort, Mrs. Cuthbert Flynn, Ms. Daly, Mr. Daly, Mrs. Dalrymple Philibert, Mrs. Dalrymple Philibert, Dr. Dunn, Mr. Fagan, Dr. Ferguson, Mr. Golding, Dr. Guy, Ms. Hannah, Mr. Hales, Mr. Hales, Mrs. Holness, Mr. Hilton, Mr. Jackson, Mr. Kellier, Dr. McNeil, Ms. Neto, Mr. Paulwell, Mr. Michael Phillips, Dr. Phillips, Mr. Pickersgill, Mr. Redmond, Mr. Robertson, Mr. Robinson, Mr. Stewart, Reverend Thwaites, Mrs. Vaz, Mr. Dwayne Vaz, Dr. Wheatley, Mr. Wright. Mr. Chuck, Mr. Heroy Clark,
Statements by Minister.
Mr. Speaker, we will start today's proceedings with a statement from the Minister of Health and Wellness. Then we will have a statement by the Honourable Minister of Justice. Later on, we will I think he has called to a higher meeting downstairs. And then we will have the National Housing Trust on the notices of motion given orally, the housing benefits, Silverson Housing Development Order that will be taken by Deputy Speaker. Then there will be the housing benefits, Ruthven Towers Housing Development. That too will be taken by the Deputy Speaker of the House. Then on legislative matters, it is hoped that we will conclude the debate which was started last week by the Minister of Science, Energy and Technology, and we will hear from the opposition spokesman, the member from Southeast St. Andrew. Mr. Speaker, the Minister of National Security will report on the Joint Select Committee of the Parliament, which was set up in the to review and report on the Criminal Justice Suppression of Criminal Organizations Act 2014. And the debate will continue. Very interesting debate. I'm sure there will be contributors to it who will debate vigorously on the issue of the Dangerous Drugs Amendment Act 2015 be changed to the Jamaica Cannabis Development Act that was presented here by the member from Central St. James, who will hopefully conclude that matter today. So, Mr. Speaker, if you invite the Minister of Health and Wellness to make his statement, we can get on the way.
House Leader, I notice you have not indicated whether the Most Honourable Prime Minister will make a statement.
I can't speak on that categorically because there have been intervening matters that have presented themselves. But in addition to that, the Minister of Health will make a rather extensive statement today. And yesterday at the press conference at Jamaica House, there were no changes to the orders which would necessitate the Prime Minister advising the House. So I will contact him to see if he is able to make it. But in the absence of the Prime Minister today, the Minister of Health, I'm sure, will bring the House up to date on the most recent developments in health.
Mr. Speaker, thank you. House Leader, I asked a question because for the past probably this is the 5th week, if the Prime Minister makes a statement, 6 weeks, the time of the statement has been very, very late in the night. The truth is, Mr. Speaker, the standing orders speak to statements by minister, which is carried at an early part of the sitting of the House. And I suspect in their wisdom, those who crafted the standing orders recognize that statements by ministers, and in particular prime ministers, are usually done because they are important matters to alert not only the parliamentarians but to the nation. We do understand, Mr. Speaker, as I've said before, and the leader of the opposition said last week, that there are times when the Prime Minister will be required to make a statement which would come at any time during the course of the sitting, but certainly not repeatedly 5 or 6 weeks in straight. And Mr. Speaker, it speaks to an almost scant regard for the members of the House on both sides, on both sides, on both sides. You see, Mr. Speaker, we expect the Prime Minister, if he's going to make making a statement, to do it in the time that is slotted in the standing orders to be done. And we have repeatedly asked for this, Mr. Speaker, and we will continue to ask for this. I suspect very strongly that sometime during the course of the day, the House leader might advise us that the Prime Minister is going to make a statement. But the truth is, Mr. Speaker, we need to ensure that it is done early. We need to ensure that the members who come for statement by ministers, right? Not that is an excuse for them to leave early, but those who come for statement by ministers can contribute to the discussions that are taking place so that we can have a fulsome deliberation on the matter.
Doctor, I don't wish us to have a debate on this matter at this time. We could wait until we reach announcements, because I have an announcement to make. However, you insist on doing this. I'll just say that the Prime Minister or any member who wishes to refer to an item on the agenda can do so when they get in the House, as for a suspension of the standing order for that item to resume. We don't have to wait on anybody. So if the Prime Minister has a statement to make, when he arrives, he will refer to the Leader of Government Business. Leader of Government Business will rise and move a motion for the standing order so that such an item can take place.
Mr. Speaker, I think you're misunderstanding my statement just now. The fact of the matter is that I'm aware of the procedure of the House. All I'm saying, Mr. Speaker, is just as us as parliamentarians are expected to obey the same rules that we draft for our operations in the House, which is the standing orders. We also do legislative matters here and create laws with which we expect the country to follow. I'm not saying that we cannot have instances where there are changes, especially in terms of the Prime Minister making a statement. But what I'm referring to, Mr. Speaker, is the fact that for 5 weeks so far, we have had the Prime Minister's statement at a later point, almost at the end of the Parliament. So we are asking, as members of the House, from this side, and I'm sure from the other side too, that the Prime Minister's statement follow the order paper.
Doctor, I am making a record, and I would refer you to answer it, that it is now 2 minutes after 3. I'm going to ask you to count members in the House at 5:30 this evening. And you will find that we don't have more than 3 or 4 or 5 on one side. And members must understand, if you are going to give a half a day to the Parliament of the land, you don't just run, come in the morning at 3 o'clock, and by 4 or 5 o'clock, the House is empty.
And Mr. Speaker, I'm glad you appreciate that.
I appreciate the fact that
that is the very thing I'm speaking to. that if the Prime Minister makes a statement at the appointed time as per the order paper, then we would have a greater contribution by the members in the House. And Mr. Speaker, I refer you at 5 o'clock to look on both sides of the House too.
Okay, I hope that the Minister will convey that. But
House Leader,
members,
House Leader, if you
it
just
is
allow
not
me,
an item for debate at this time.
Mr. Speaker, on the agenda that was circulated, there was going to be a statement by the Minister of Education. In light of the fact that that is now uncertain, is the House Leader going to update us on the about face that he made at a press conference yesterday on the government's position of the Jamaican students sitting the CAPE and CSEC exams? Because this is a very important matter for tens of thousands of Jamaicans. And we really need clarity and to make a few incidental comments at a OPM press conference and then come to Parliament today and we're getting no statement on the matter. I think that's unacceptable. So given that the de jure Minister of Education, who was on the order paper, on the agenda of the House, to make a statement, will not now be making a statement, can the House Leader tell us if he, on behalf of the Minister of Education, is going to make a statement on the...
First of all, Mr. Speaker, I listened attentively today to a very popular radio talk show, and I heard a former Prime Minister who served in this House for just under 5 years, but who had served in this House for over 20 years, make a statement. And the statement was very categorical. He referred to all Prime Ministers prior to the one that now resides in Jamaica House. And he indicated that in all of those Prime Ministers during their term, none has ever been faced with the level of crisis that this one is faced with. He further went on to say and to applaud the stewardship of this Prime Minister on the handling of that crisis on behalf of the people of Jamaica. One day, maybe, you will be facing the same set of challenges. And when you are Prime Minister in charge of a country, you don't have the luxury of free time. I know from up close that he doesn't have any time for himself. He devotes every single hour of his awakened life on behalf of the people of Jamaica. He doesn't have the time to idle and to go on social media to promote himself. He works for the Jamaican people full time from Jamaica House. So when you seek to challenge the attitude of the Prime Minister with respect to statements, remember, my learned friend, that he served in this House as leader of government business for over 4 years. He is well seized of all that it implies. And he has a full appreciation and respect for those of us who serve in this House. And I can tell you quite frankly, I am sorry when he's not here, because I enjoy his presence in this House as an inspiration to all of us who sit in here. And no one can deny his stewardship in that regard. So don't try to suggest that he's being negligent or disrespectful. Anything but. As usual, I will try to communicate to him and request that if he has the time, he could come in and make a statement. I mean, if he has the time, he's about the people's business. A lot more that can be said for many of you. So, Mr. Speaker, I rise in this way. I rise in this way because
Minister
I
Samuel,
cannot... Hold on a second, Mr. Speaker.
Minister Samuel, I do not wish to disrupt or disturb you. I just wish that we would follow the standing order and that we would proceed with statement by a minister at this stage rather than having a debate on an item that is not on the agenda.
In respect to statement by ministers, I have been challenged. I have been challenged that I have not presented, or I have no intention of presenting the report of the most current developments in the Ministry of Education with respect to the hosting, with the CXC examinations that are to take place in July. The fact is that a fulsome statement will be made in this House next week by me on the matter. But we don't operate on knee-jerk responses, and we certainly, and the comments by the member, this abrupt about face is absolutely insulting and rubbish. Absolutely insulting and rubbish. And in your want for unworthy speculation, and insultive nature, right? I am offended by the suggestion you have just made. Ask the member from Central Kingston, where I was for most of this morning. We work hard on this side. And that is why we will remain on this side for the foreseeable future.
Mr. Speaker.
Members.
Mr. Speaker.
Doctor, could you hold a minute, please? Members, you have given us a procedure in this parliament. Order, please. Order, please. We are not following the standing orders. We are not following standing orders. I'm not going to take it any further at this stage. I'm going to ask Dr. Tufton.
No, Mr. Speaker. A precedence has been set, and I think the records need to be corrected. First of all, Mr. Speaker, the House Leader went on a rant, which he's accustomed to doing, and
I'll give you the right to answer.
The unfortunate thing is that he has gone a little further. The truth, however, Mr. Speaker, back to the substantive matter. The substantive matter has to do with the respect to the Parliament. And it doesn't matter if the fact that the Prime Minister has served at a particular position for 4 years. Doesn't matter whether he's leading the country at a difficult time. This is the Parliament of which he's a member. And the other members of the Parliament expect... No,
that is insulting. How can you say that of the Prime Minister?
That what?
That he does not respect Parliament.
No, I didn't say that.
Insulting.
No, House Leader. I did not say that. And if you interpreted that as to what I said, you're misinterpreting. No, did not say that. And we can ask for answer for that.
Members,
right?
Please.
What I said, Mr. Speaker.
Dr. Guy.
Mr. Speaker, the inference alone is enough.
No.
You should withdraw that comment.
I think you've had too much, Mr. House Leader. What I'm saying is that the member of the House, being the Prime Minister, right, needs to treat the House with the respect that the other members expect to be treated. Simple.
Dr. Tufton. Statement by me. Order, please.
Thank you very much, Mr. Speaker. Mr. Speaker, I stand today at the cusp of a new phase of the implementation plan for COVID-19 management for Jamaica. As you may recall, the Ministry of Health and Wellness at the beginning of this experience outlined 4 phases for this COVID-19 response. Those being interpandemic phase, alert phase, the epidemic phase, and the recovery phase. While the ministry is very cognizant of the fact that the current state of the epidemic is still very fragile and adherence to the infection prevention control measures are critical to the mission of management and the control of the epidemic, we must now begin the process of preparing the population to live with COVID. Living with COVID, Mr. Speaker, will represent many actions in the public health system as well as in the general population. This, Mr. Speaker, will become our new normal in public health and must underpin by 3 strategic goals. These are protecting the population from harmful health outcomes, particularly vulnerable communities, ensuring productive engagement of the individuals within the society, and creating an environment where citizens can participate in meaningful social activities that enrich their lives and the lives of all with whom they interact. Mr. Speaker, within this new strategic framework, the prioritization of public health and the reintroduction of everyone counts approach to policy must form part of the way in which we must now live and operate. On our part, the Ministry of Health and Wellness has already begun to build out an infrastructure that will allow us to play our role within this new normal. This approach is anchored in the international health regulation standards for public health systems and will involve the strengthening of systems in 8 key areas: legislation and policy, coordination, surveillance, points of entry, that is our sea and airports, lab services, human resources, health facilities preparedness and response, and risk communication and community engagement. In each of these areas, the Ministry of Health and Wellness will be working in collaboration with the key stakeholders to achieve the strategic mandates that I have just outlined. Mr. Speaker, ensuring that everyone counts. In implementing these plans, the Ministry has already received approval from the Ministry of Finance and the Public Service for the employment of an approximate additional 1,300 community health aides. The regional health authorities have already begun the process of recruitment, and these new officers will augment the existing cadre of approximately 2,300 persons currently in the field, bringing our total complement to approximately 3,900 across the island. In our new normal activities, field surveillance using methods such as contact tracing, community education and health information, and the monitoring of persons in quarantine and in isolation will be important components of the public health response. The addition of these officers, Mr. Speaker, therefore, will enable the government to continue our efforts in early detection and strengthening our capacity to contain and to manage any infection once they are identified. Our efforts to strengthen the regulatory and legal framework has also been actioned. The Cabinet has already given approval for a partnership with the Ministry of Justice to strengthen our public health laws, to ensure better protection of the population and securing the rights of individuals even within the context of a crisis. In the spirit, Mr. Speaker, of ensuring that everyone counts in this and all our public health efforts, we have begun our engagement with the private sector to ensure that the most appropriate protocols for return to work arrangements can be put in place. The PSOJ, the JMA, the JHTA, and the JCC, and the trade unions have all come to the table in a spirit of partnership to ensure that we are able to build robust protocols that protect the worker, protects the clients, and ensures overall improvement in productivity. Mr. Speaker, this is the new norm. This is living with COVID-19. Mr. Speaker, it is to be noted that as a public health authority, we are not anti-business and appreciate the need for a viable and sustainable economic activity underpinning the well-being of the whole of society. And I want to just reinforce that comment, Mr. Speaker, because we appreciate and understand that in the interventions that we make as public health, sometimes it can be misinterpreted as us blocking the economic activities which are so important to the country. And this is certainly not the intention. At the same time, Mr. Speaker, it is important that this COVID-19 experience has shown us and the world that economics without a healthy population can be undermined and indeed can be unsustainable. As such, the new normal must recognize that everyone has a role to play, not just as individuals, societies, or countries, but as an integrated whole that supports the health and well-being of us all. Our work in the public health system is now in high gear, and it is our intention to ensure that all 4 health regions are equipped with the additional 16 ICU and HDU facilities to respond to the extreme healthcare needs. As of today, the capacity of the health system has been increased with 41 ICU beds, 32 new ventilators, and 140 monitors. These have all been procured, are either here or on their way here, based on an adjustment to the threat as represented by COVID-19. We have expanded the cadre of critical care clinicians through our partnership with the Cuban government, with an addition of over 200 healthcare professionals. We have restocked our complement of PPEs, personal protective equipment, and we have strengthened significantly our ability to manage and support patients with infectious illnesses with the addition of the COVID-19 wards, inclusion of infection prevention and control training, and revised protocols in hospitals and health facilities. Mr. Speaker, our primary healthcare system, in addition to the complement of community health aides, will also benefit from the deployment of the PAHO WHO Go data system that will not only enhance our capacity to capture information, but strengthen surveillance for disease control. In the past 3 months, Mr. Speaker, we have increased our capacity at the National Influenza Center and the National Public Health Lab to do PCR testing. At the beginning of the COVID-19 experience, samples had to be sent to CARFA in Trinidad. That, Mr. Speaker, is no longer necessary because we have added our own internal capacity. However, since March 10, when we had our first case, to now, Mr. Speaker, we have increased our abilities to ensure that we can test on island, but also, very importantly, that we can test a fairly significant number of samples once collected, nearly 2,000 or just over 2,000. This is part of the strategy for the new normal, Mr. Speaker. As companies and other interests return to work, the need for more testing, we fully appreciate, is critical. As such, we're building out the necessary protocols for antibody and PCR testing to ensure that we can provide the support that is necessary for the effective and efficient operation of the society. Testing in a methodical process, Mr. Speaker, so that we have the best possible understanding of the COVID virus in our population and are able to respond appropriately. This, Mr. Speaker, has to represent the new normal that we speak. Within the new normal, we must ensure that we are aware of the risks and that these risks are managed both on the personal level and at the level of the society. Mr. Speaker, it is important that as a country, as a population, we recognize that within this new normal, everyone counts. Everyone has a critical role to play. As a society, we must have a sense of heightened awareness and accountability for our own personal health and take charge of this responsibility by ensuring that we have all the required information to make rational choices as we go about our daily lives. The Ministry has already engaged in our health promotion and protection strategies, which has yielded significant outcomes in terms of the behavior of our population, to the washing of hands, the sanitization of surfaces, and the wearing of masks. These actions not only protect you, but also protect those among us who may be least able to protect themselves. As we return to work, Mr. Speaker, there is a need for increased vigilance and adherence to these protocols. Now is the time when we are required to put into full practice all the actions that we have been using to ensure that we not only prevent ourselves from infection, but that we protect the vulnerable. This is part of the way forward, Mr. Speaker. This is part of the new normal that requires everyone to play his or her role. Lastly, Mr. Speaker, I must touch on the issue of stigma and discrimination. Our experience as a society, Mr. Speaker, with COVID has shown that the hidden dangers of heightened levels of fear, which leads to irrational actions, can lead to very negative outcomes. As a people, we must note that as we ensure that everyone counts, persons who have been affected by COVID-19 are seen as part of the answer and not part of the problem. We must ensure that in the new normal, antisocial actions that lead to persons being discriminated against because of they may have contracted the disease, these actions, Mr. Speaker, must be highlighted, discouraged, and eliminated. COVID-19, Mr. Speaker, will be a part of this new normal for some time to come until modern science catches up with this virus, this disease. It is not, Mr. Speaker, a death sentence, and the country needs to come to terms with that reality, despite the fears associated with the virus. That is important because we must manage the process, not allow the process to promote panic, fear, and dismay. Over 98% of the persons who have contracted the disease in Jamaica, Mr. Speaker, have either recovered or are well on their way to recovery. In an effort to ensure that everyone counts, Mr. Speaker, we must build within our health systems the ability to ensure that persons who are infected are integrated, are assisted, and recover to live their lives in a productive way. Mr. Speaker, thank you.
Members. Members, we are having some difficulty by not following the procedure. And I am being attacked for not following the standing orders. So I'm going to ask you to permit me to follow the standing orders. In this instance, the standing order says a statement by a minister shall not exceed 12 minutes. But the minister, according to Hansard, spoke for 14 minutes. It says that the opposition spokesman should answer in 5 minutes. And because the minister took 12. I'm going to make available the same extra 2 minutes to the opposition spokesman, so he will get 7 minutes. Order, please. It goes on to say all other members can ask a question, not a debate. And it says, I'm taking the time to tell you because I'm going to enforce it. It says, gentlemen, if a question shall not be into the number of persons, sorry. After the answer to a question has been given, supplementary question may, at the discretion of the speaker, be put for the purpose of elucidating the answer given orally. So I'm going to ask members, do not get up to give a speech before you ask your question. And since the minister, as I said, went over 2 minutes, I'm giving the opposition spokesman similar to go over 2 minutes, and then all other members can follow this standing order. Do not get up and give a speech. I will not permit you. Dr. Guy?
Just before
Dr. Guy?
Mr. Speaker, may I just...
Dr. Guy has been recognized.
On a point of order then.
Dr. Guy has been recognized by the Speaker.
I have a point of order. I have a point of order. I have a point of order.
Member.
Mr. Speaker, I respect your chair. I respect your position.
Are you the opposition spokesperson?
No, I have a point of order, which is allowed. You can't stop me from raising a point of order. Yeah, I'm going to state it, if the Speaker will allow me. In case of issues of national interest, national importance, the Speaker, and you have been doing very well for the past 6 weeks in giving some latitude for members to raise issue. I suggest, I recommend to you that you return to the normal position which you have taken before to allow some latitude when we are discussing the COVID outbreak.
Member Bellas, may I assist you? That's not a point of order. However, I will accept it as an advice.
I am much obliged, Mr. Speaker.
And I will take note of it. But I'm going to ask you to permit me to follow the standing orders. Dr. Guy, 7 minutes.
Thank you very much, Mr. Speaker. Mr. Speaker, you know, I've been looking and listening and reading this document by the Minister. And the first observation I want to make that this whole concept of new normal is an oxymoron. You can't have a new normal, but I understand what the Minister is really saying. It's a new way of life in terms of how we are going to go forward. The truth though, Mr. Speaker, as we have said, and as far back as 2 weeks ago, when the Prime Minister gave his statement at about 10 o'clock one night, when he was speaking about reopening, the potential for reopening the economy, I indicated then, as did other members, that to reopen the economy in the whole pandemic, one needs to be guided by data. And we recognize that to get that data, the only way you can have it is to do more testing. So far, the records have shown that even when we had the capacity of just over 1,200 per day, and when we went to over 2,000, we have not been more than 461 tests in any one day, in any one 24-hour. We have the capacity of over 2,000. Now, Mr. Speaker, if we are going to reopen the economy, one of the important things that needs to happen, as we have said before, is the need to ensure that those actors that you have that are required to reopen the economy need to be tested. So we look at those who work in the industries where there are a lot of people who are going to be congregating, getting in close contact with each other. The transportation sector, the factory workers and all those which are vital to reopening the economy, but are also significant conduits for the transmission of the virus. Now, I'm happy that the minister has mentioned too that there's going to be some antibody testing, because that matter came up for discussion before, and the member from Eastern St. Thomas raised it at that particular point about 3 weeks ago. The response then was that antibody testing will have its place at a particular time. I think we are there now, Minister. We are there now, Mr. Speaker. And it's high time that we roll out this particular form of testing to ensure that we protect those persons who we expect to go out there and reopen the economy. The matter of the community health aids. Minister, you indicated that you will be employing 1,300 more. You have gotten approval to add to the 2,300 that is already there to get 39,000. 3,900. So there's 300 missing. Where is it that these are coming from? Or can you advise the Parliament about that when you answer the questions? But unless we protect those who are out there who are exposed to the disease, and you mentioned that there's adequate supply of personal protective equipment, you will recall that earlier on today I asked you in the Parliamentary Committee about personal protective equipment, because hospitals sometimes, as you alluded to, answered that they run short on supply. Now, if we have sufficient stock at the National Health Fund, then we ought to ensure, and I've spoken to this before, that the logistics of the chain supply is really monitored so that we don't have people who are out there thinking that they are on the last amount, what is going to happen next. And the same thing happened, Minister. When you were running short, the country was running short of the swabs for the taking of the samples. Reports came out of some of the parishes that the health workers did not know when the supply would be depleted, so there was some walk-through instead of run-through in getting the samples done. And this might have contributed to some of the low sampling we had at that particular time. But I'm happy that you reported that we have over 20,000 as of yesterday in respect of that. Minister, the health service is, we all know, under stress. It is something that we all know. No health service in the world was prepared for COVID. The truth, though, is that ours is at a stage where we need to have more done for the health sector with COVID and without COVID. The process of transforming some of the wards in the hospital as COVID wards, and all have not been done. We need to increase the rate at which that is done, and also increase the rate at which the supplies are given to these hospitals to ensure that those wards are adequately equipped. I'm happy that you have mentioned that we have all these new ICU beds and monitors and equipment for high dependency units. But even at the basic level, we need to ensure that these are properly equipped and functioning, and that the workers are able to appreciate and understand the role of these in the process. Now, we have been warned by the World Health Organization and PAHO that with the reopening of the economy, what will happen is that we will see a spike in the number of cases. You know, interestingly, there's a leader of a particular country who is suggesting that we have no more at one stage said that we don't have any COVID, and it was simply because we weren't testing. The truth is that with this respike that is, or the spike that is anticipated by all public health data gleaned from across the world, I'd like for you to advise the House as to what measures are going to be put in place further to ensure that we do not as a country fall to the position like some have where we have a significant number of deaths. We have been fortunate so far, for whatever reason, that we have only had 9 deaths in the country. And this is a commendation to our health workers in ensuring that this is done. I asked you this morning, however, Minister, that let us not fall into this sense of security as the Russians did. And I'll explain to those who are in the market right now to try and appreciate what the Russians did. They said, Mr. Speaker, that they were managing it very well, that the numbers of positives were low. But when a particular medical investigator, a doctor, assessed the number of deaths that had taken place within the 4-month period, it was thousands more than took place within similar periods of previous years, which suggested, which suggested that people were dying as a consequence of COVID. Now, whether we have that or not, all we need to look at is a check at the RGD. Simple. Now, Mr. Speaker, it leads me to one other point, and I'm sure others will speak to it as well or ask questions. The whole tourism reopening, and how do we plan to deal with it in light of the fact, Mr. Speaker, that we created such a significant issue in trying to repatriate 1,044 Jamaicans who work in the tourism sector. We as a country, right? What I'd like for Minister to tell us is what proposals, what plans, what protocols are in place. Because right now, if we are going to reopen the economy, the Prime Minister stressed how important tourism, then certainly it should have formed a greater part of the plank of the presentation as it relates to how we are going to deal with it. Thank you, Mr. Speaker.
Thank you, Member. Mr. Speaker, let me just begin by saying that and it's partly in response to the member's intervention earlier, the member from Northern Clarendon. Mr. Speaker, please let me just remind the House and those listening on that there is a special select committee of Parliament to discuss the matters of COVID and the COVID response. It meets weekly. It has representation from both sides, including the opposition spokesperson on health, as well as the opposition spokesperson on finance, as well as I'm not sure if you're former opposition spokesperson on local government, as well as members of this side. And every week, Mr. Speaker, we give a fulsome report, we go into details, and we indeed, based on the concerns of members, particularly members on that side, we invite special experts to come in to report on matters around COVID. So I just want to say, Mr. Speaker, that the opposition cannot claim to be in the dark as it relates to matters of COVID. They cannot, because Parliament has made provision for detailed discussion. That's one point, Mr. Speaker. Well, let me just...
the Minister... Point of order. No. Can the Minister clarify exactly what he meant by the opposition being in the dark, because as far as I'm concerned, in terms of my statement just now, there was no suggestion of that being the case.
And I'm glad, member, but you have colleagues who think otherwise, so I just want to make it very clear. Mr. Speaker, to say, just by way of context, to say that the statement that was just delivered was an attempt at giving a broad framework as to what the next phase of the COVID response represents. And over time, whether at this Joint Select Committee or otherwise, we will provide details, better particulars around specific issues. So this is just a signal that the government is moving to a phase where we have to put the infrastructure in place, whatever those infrastructure represent, personnel or otherwise, to deal with the realities of COVID while the rest of the country can move back to normality. And I just want to reiterate that because that's important, as I believe both sides agree. In terms of the testing concerns, Mr. Speaker, testing continues to be a controversial point. And I dare say it is not unique to Jamaica. Many countries in the world have had different experts placing different opinions around to test or not to test or the extent of testing. We have been guided, Mr. Speaker, by a testing protocol that is influenced by the WHO PAHO or PAHO WHO. We have focused not only on the numbers of tests, Mr. Speaker, but on the methodology of tests. And frankly speaking, Mr. Speaker, we believe, and certainly the clinicians who manage this process, I'm not a medical practitioner as the opposition spokesperson is, I take advice. They believe that the testing approach has been appropriate to date. However, as signaled in this document, in my presentation, we are now moving to a phase where that will change. And the member will get better particulars on that in due course. I think we are all agreed that like antibody testing becomes now necessary, and that is now being planned for. Indeed, we have antibody testing kits on order, but we'll give particulars on that later on. In terms of the community health aides, we are pulling, the recruitment is now taking place, and there are persons in the society who have been trained at the level of heart, persons with 3 or 4 CXC equivalent, and those are the persons who are the prime target for recruitment and for training, because it's going to also involve training before we deploy those individuals. In terms of PPEs, Mr. Speaker, we have done well to date as it relates to providing PPEs for frontline practice personnel. I don't know of any case, as is the case in other jurisdictions, where persons are reusing PPEs, trying to sanitize when they are supposed to be disposables, because we have really made the effort and have provided adequate numbers of PPEs. Now, within that category of personal protective equipment, there are some items that have been less available than other cases. Shields, for example, protective shields, have been difficult to come by. In the earliest days, we could not get them into the country for a lot of reasons, whether logistics or just finding a source, or countries taking measures to protect their own population and so holding on to the supplies. But it has gotten better. And the worst I've seen it in our public health system at the institutional level is where a hospital would say we are low on supplies. But I can't recall a hospital saying we are out of supplies. And I think that is positive. So we will continue to manage that process, Mr. Speaker. The member speaks to the WHO's prediction or forecast that with the opening up, we are likely to experience a spike, and how ready are we for that spike? Well, needless to say, Mr. Speaker, I think we have done well to date, and I think the praise and the recognition belongs to the frontline workers or healthcare workers. And I don't believe there's any controversy around that. We have done well because our contact tracing and those public health inspectors, public health nurses, community health aides who go out in the field and identify persons who are vulnerable, do the sample collection. They are the ones who are our true heroes, supported, of course, by all the other public health staff. Preparing for this new arrangement of opening up, we anticipate that the risk will become greater as we open our borders for more persons to come in and as persons move freely about to remove the restrictions. That is why, Mr. Speaker, we're preparing in terms of the community health aides, so we'll have more boots on the ground. That is why we have prepared our hospital system, where we have over 300 COVID beds that are available. We have established COVID wards in every hospital. In terms of the training and retraining, and in terms of the supplies that are necessary. What we have done in general terms, Mr. Speaker, is to identify the most vulnerable in the society. Because, frankly speaking, and we're going to have a frank conversation about this, the likelihood of COVID claiming the lives of young people, as is demonstrated with the short history of the virus, is relatively low. The persons who die from COVID are normally persons who meet a certain criteria. Over a certain age, underlying conditions, lacking basic amenities, those are the persons that we have to identify. And part of that strategy going forward is to ring-fence those communities and individuals and provide them with adequate support to prevent the virus, but once the virus touches down, to identify it quickly and to move in and quarantine and manage that process. And that's exactly what we've been doing. So in a sense, Mr. Speaker, we have been training and preparing for the days when we will have to open up and return to normality. And I think our workers have done well to date in that preparation. Finally, Mr. Speaker, in response to my colleague, I am told that there is no discernible difference in terms of deaths. I don't have the specific numbers of the first 3 months of this year versus the first 3 months of last year. So I would encourage a member to discontinue using that Russian experience because it doesn't apply to us. We have had 9 deaths. We have had 9 deaths. We have had 9 deaths, Mr. Speaker, unfortunately so. But every single one of those deaths, again, meet the criteria of underlying conditions. Even that 2-year-old child had significant issues. I won't go into details. And that tells us something. It tells us that that is where our focus needs to be as we move the process forward. The tourism industry is a key economic industry for us. And clearly, it also represents a potential threat because of persons coming in and going out. Part of that management is a protocol. The Ministry of Tourism has already drafted in consultation with health, some of our health personnel. That is now under review, and we will finalize that, and that will be made public in due course in order to protect both our visitors, but also, very importantly, our locals who work and interact with the industry. So, Mr. Speaker, we are planning, we are managing, we are organizing, and we certainly look forward to the cooperation of both members on both sides.
Just 2 comments, Minister. It's interesting, and I know we are in the age of data and computerization, but this morning you didn't know anything about the increased deaths, and you know it now. But I think you should still have a check with the RGD about this and have them investigate, because I will not resile from saying what I'm saying until I have the actual figures. Secondly, you have not explained the discrepancy in the 300. The 300 that I spoke about. You have 2,300 current workers. You're employing 1,300, and you say you bring the complement to 3,900. That's what your speech says. So 2,3 and 1,3 is 3,6.
Daly.
I'll check on it, member.
Thank you, Mr. Speaker. Minister. It's Buchanan Speaker, it's not Campbell this time.
I thought it was Campbell. What was his name? Yeah, you may go ahead now.
Thank you, Mr. Speaker. Mr. Minister, in this new normal, whilst the death toll has not been high, I'd like to know if there is, though, within the Ministry of Health, a protocol as it relates to disposing of our loved ones through death caused by COVID or COVID-related issues. Because I firmly believe the communities need to know, the country, the health workers. Recently there was a case in my side where a person was to be buried and the community was up in arms. Even the Ministry of Health personnel were not absolutely clear about the protocols as it pertains to how we treat with the burial or disposing of bodies of our young loved ones. So, as a minister, I crave your guidance.
Mr. Daly.
Thank you. Minister, thanks for your statement. Given the latitude that the Speaker has been giving us in discussing COVID, I hope that it will continue. And how could you give a statement to the House today without mentioning our 1,044 ship workers and what is happening with them? Having gone through that ordeal at sea, so I'm asking you, no, I'm telling, as a former Minister of Health, let me say to you, your staff that prepared this statement for you made an error. They should have allowed you to say something, an update to the House as to what is the status of these 1,044 workers. And it's a pity. And I hope when the ship is going, you send back Chuck with it and send him somewhere. Minister. No, I am going to welcome them on behalf of the opposition. I am welcoming back the 1,044 Jamaicans that the government of Jamaica pussyfooted around, if that is a parliamentary term, wasted time and could not establish a simple protocol to repatriate these people. And I'm telling you, you stressed out the workers, you stressed them out. Stress them out. And the others, I hope that those who are coming, where are you and where was your voice a week ago when they sailed to Haiti and when they sailed to other places?
Mr. Daly.
And could not come to their own country. But I am just hoping that the minister just update the House and don't listen to the sideshow. Just give us a word as to what's happening. Because a lot of time was wasted. And cruel treatment of our Jamaicans. Cruel, heartless and wicked treatment of our Jamaicans. Mr. Minister. No, I want your attention. Right. those Jamaicans that were in quarantine at Bahia Principe, have they all been tested? Or was there the need to test all of them, those who were in quarantine? And I am glad both yourself and the Prime Minister apologized to them for the treatment that they have endured while in quarantine. And it's man of you. And I must tell you, I appreciate it that you man up and apologize to them for the treatment that they receive. Because you say you didn't know about the treatment and you went and visit them. And we applaud you for that. I'm asking you if all of them have been tested. Because you have capacity. At one time we didn't have the capacity to test. For the last 4 weeks you have been telling us Jamaica has the capacity to test. What is happening while we are only testing about 300 or 400 a day? Tell us what is happening. The country needs to know what is happening, why the testing is so short. At one point, Mr. Speaker, we accepted the explanation of the health officials. We accepted it in the Special Select Committee that the health officials were afraid of the test, to carry out the test. Then the other week, we had a report that we didn't have enough samples to test. And we didn't have enough equipment. And we spent a lot of money and put in the new equipment at the National Public Health Lab, which we applaud you for. We did the virology lab when we were there, and you expanded that. I'm saying, why aren't we testing more? I say we did it, we. Regarding the recruitment of the 1,300 community health aides, during Zika and the dengue outbreak, you had 1,000 or so. Will they be? They're still in the. No, I'm not asking. Will they be a part? Because you reported that you had about 1,000 trained and working in communities. Is it a new 1,300, or you're going to use some of these people in the fight against the COVID virus? And my last question, PPEs. I understand that as the minister, if you don't call the people who are in supplies to tell you, you will not know. I understand. And you don't, if you don't know, you don't have to answer, because I understand. If all the primary health care facilities, like the James Hill Clinic, the Crofts Hill Clinic, the primary health care frontline facilities, the Kellits Health Center, and all those even if they have adequate supply of PPE, can you tell this House?
Dr. Tufton, I don't wish to direct the minister, but I'm going to ask the minister to answer the question rather than giving another presentation.
Not my intention, Mr. Speaker, but I am so advised. Thank you.
Don't give them a presentation.
I am so advised, Mr. Speaker. The issue of the protocol as it relates to burials, yes, there is a protocol, and if you need it, if you need it, I could make it available to you. I can't go into the details of it, but I can make it available to you. But there is a protocol as it relates to COVID persons. Mr. Speaker, as it relates to the vessel that came in today, we did speak extensively to the matter. Granted, it was outside of this House. Last evening, the Prime Minister gave an extensive press briefing. It was reported extensively, but I appreciate the member wanting a conversation here. So I have no difficulty with that. Just to say that the arrangements as it relates to the vessel is a collaborative effort involving multiple agencies, national security, which deals with immigration, customs, transport, foreign affairs, and of course public health. I'll reserve my comments as it relates to the public health issues, given that that is where I am most seized. The vessel is in, and it is now being processed by the immigration custom authorities. We intend, from public health standpoint, to begin the process of collecting samples on Thursday morning, because I believe they'll need another day or so. Among the work to be done is to replenish the vessel with food, water, supplies generally. So we don't want to be doing at cross purposes, so they're going to be doing that over the next day. Thursday morning, the intention is to have the public health team on site, where we will remove in 200 batches Jamaicans whose samples would be collected once they are taken off. Then they will be transported to the location which we have announced publicly, the hotel, and held in quarantine arrangements under quarantine rules for 3 days approximately, at which point we will have the results of the tests. Those that are positive would be placed in appropriate health facilities. Those that are negative will be processed and placed in home quarantine arrangements to the extent that those home quarantine arrangements are appropriate. So the team has to do some inspections of where these persons reside. And there will be an appropriate level of monitoring for 14 days for these individuals during the home quarantine arrangements. At the end of that process, another test should be administered. And then, of course, depending on the results, then persons will be integrated back into their community. So it's a relatively straightforward approach. However, it does require significant manpower, human capacity, particularly as it relates to the monitoring arrangements and the quarantining arrangements. And in a sense, that would have accounted for the length of time in negotiating this arrangement. For example, member, and I know you've obviously been critical of the approach that we have taken. The vessel had to agree to remain in port for 2 weeks because the numbers on the vessel, the time to process these batches, it was either using the vessel as a quarantine site, which meant that public health had to manage the process of testing on the ship. And by the way, there were more persons on the ship as part of the crew for operating the ship than actual Jamaicans. I believe there are about 1,500 crew members on the ship. So not only would you be processing Jamaicans, you had to contend with other nationals on the vessel. So we had to negotiate all of that. It's not a 1, 2, 3 very simple arrangement. Now the vessel has agreed to be in port for that period of time, and it would be easier to take Jamaicans off, but we can't process 1,000 persons at the same time for many reasons, hence the length of wait. But I think we are in good stead now, and we're going to be working through that process, not just with this vessel, but with other vessels that we are having discussions with. In terms of the Bae Principe, you were asking about the conditions there, or testing. Yes, all have been tested, as I am understanding. All persons there currently. Yes, this is what I'm understanding. So it's for them to get the results of the test, and to the extent that persons, they have to serve the 14 days. I think they have gone 7 now. So yes. Even if they're negative, because of the way the virus. The issue of testing, member, the fact that we have the capacity to do 2,000 tests per day or thereabouts, if we run multiple shifts, shouldn't be an indication as to whether or not we're under testing if we do less than that number. And I don't understand the logic, because it has been made several times. We can do 2,000, why are we not doing 2,000? It's not just about numbers. The approach to testing is as important, or perhaps even more important, than the number of tests that are done. And I've said it over and over and over. I've said it over and over and over, but this is obviously not getting through. And we have said it We have said it at the committee. The experts have said it in your presence, member, but yet you still persist on this line. Nevertheless, we believe that the testing approach to date gives us a good reflection as to what we are doing in the population. We are not deliberately under-testing to hide numbers. That would not suit us, and that would be an indictment not on me as the policymaker. It would be an indictment on the public servants, and I cannot tell you that that is the case. In fact, I will say it's not the case. Our same public servants that served you as minister are the same public servants that are now serving the population. And if you trusted them then, you must trust them now. Not to say you must not ask questions, member, but I don't believe it is fair to give that impression when that is not the case. And finally, you want to speak on the testing? Okay. When I finish, okay. Secondly, member, I'm being ably assisted by a clinician on this side, so I'll yield to him for an explanation and then.
Mr. Speaker, before Mr. Speaker, please, sir, please. Honorable Minister Chang, please. The Minister of Health treated with scant regard the question I asked about the protocol as it pertains to the disposing of our loved ones who have died as a result of the coronavirus. Mr. Speaker, if there is a protocol, the minister has an obligation, a responsibility to the House to share with the House and not just to send it to me privately, because the country, Jamaica at large, is awaiting an indication from Parliament as to that protocol.
Dr. Tufton.
Mr. Speaker,
Dr. Tufton.
If the member wants
Go ahead.
specific details as to the protocol, I'm going to advise him to table some questions, and I'll do that. What I will say, that the funeral homes,
Order, please. Order, please. Dr. Tufton.
Respectfully, Mr. Speaker.
Dr. Tufton, you are only obligated to give an answer to the statement you gave. No new issue. That's what I said earlier. You gave a statement, you take questions only to those statements. Dr. Chang?
Mr. Speaker, respectfully, I respect your chair, I respect your office. I ask specifically of the minister. No, to share with this honorable House and the nation what is the protocol.
Let me advise you. The minister has a right to answer a question relevant to the statement he has just made.
And Mr. Speaker, it is most relevant.
Order, please. Order,
because
please.
in his statement, he spoke about survivors and death. So it is relevant and connected to
Will you spend a minute and listen to me? If your question is on the statement that the minister make a presentation,
Mr. Speaker.
And the minister has asked the Minister of National Security to assist him at the point. I'm going to ask Dr. Chang to proceed.
I'm not giving opinion on it.
Order, please.
Speaker, I think it's important I make a short comment on the question of testing.
Members, a question has been asked that everybody is interested in. Dr. Chang is speaking. Members, the minister has asked Dr. Chang to assist him in answering a question. He's not been given that chance, and therefore I'm going to move on. I'm going to move on. Go ahead, sir. You have a question for the minister?
Yes, a question.
Go ahead.
Minister.
Have a seat and allow Dr. Chang to.
I have the Speaker's permission to.
Have a seat and allow Dr. Chang to finish this.
No, Mr. Speaker, I think it's important. Much as the Minister request of testing, and that topic of which I will acknowledge, I think it's important I make a short comment on the question of testing. Because from very early on, there have been this continuous debate about mass testing versus structured testing. No, the testing. Because the public health officers have adopted a testing program which is efficient and better than most. Any review of any, not talking political review, any professional review of the approach adopted by the public health professionals of this country and the Caribbean will demonstrate they have adopted the most efficient and best approach. The only countries that can compare in terms of success with them today is Taiwan, which is a big, rich country, not part of WHO, and Vietnam, which have adopted similar principles. It's based on a traditional public health process, which very few countries have kept alive. The United States have nothing compared to others Europe. And we need to give credit to our professionals in the public health sector. It's one which is a structure which has crossed government lines. It has been weak at time, but it has meant that I think public health, not hospitals, the medical officers of health, supported by a team of public health inspectors, public health nurses, district midwives, clinic nurses, community health aides, which means effective sentinel surveillance, one, based on a number of primary care facilities across the island, on hospital clinics, which have enough reach to give you adequate sampling. In addition to that, quick contact tracing. This is something that is not carried out at all. In most of the countries have had serious death rates because contact tracing, in fact, I gather in New York, they don't even do it. And therefore, we have the disaster that has emerged in those societies. And in this instance, we must give credit to our public health servants who have done an extremely high-quality job, and we must not allow the debate on certain issues. Well, mass testing is an inefficient, ineffective means of monitoring COVID. That's a fact, and a waste of resources. The system, as articulated here, has worked. In addition to that, the continuity should give credit to our people too, despite of some of the challenges. What has happened in the early stages, the Jamaicans are prone to be very sensitive to the issue. And some of the success is not only based on the structure of testing, but the fact that there's a tendency, the stigmatization is bad, but it is a symptom of people reporting cases early. So most of the cases that I've gotten, even in the case of the workplace contamination, is that they get to the clinics early, and therefore it means less contact, and therefore easier to trace and contact. Let us give credit to the professionals in this country that have worked hard, served and do very well. And stop debating.
Minister, I have a follow-up to the question. Is there... but it's on the testing. And you can answer it with the... Is there a reason why...
Miss Hannah, you cannot do it like that.
How do I do it then?
That member was on his feet and you just get up and speaking.
He yielded to me, Mr. Speaker.
You don't even ask him if you can proceed. I recognize him to speak.
Mr. Speaker, if I may, Mr. Speaker, if I may, I need to just complete quickly the answer to the response.
Go ahead.
If you don't mind, and then thank you. So I want to just say that to the member who I am sure it's not because he's an investor in a funeral home where he wants that information. It's for the people of Jamaica, right? So let me just reassure him. Let me reassure him that all funeral homes have been advised as to the protocol. We have had meetings. Let me just finish. We have had meetings. And member, I can provide the specifics. It involves cleaning of the area, it involves handling of the body, it involves the personal protective equipment, and it does involve the funeral arrangements. But I can give you those generalities. But if you want the specifics of it, I will be happy to make the document available. That's all I'm saying. That's all I'm saying. In response to the final question, Mr. Speaker, the PPEs, I'd like to say to my colleague that that I can't guarantee that every single health center has everything that they need. It's a function of how you coordinate and manage the process from the regional health authority perspective. So I am sure there are going to be cases where people run out, but what is very important is that where persons have supply issues, then those issues are dealt with promptly. And what I will say to you is that the regional health authorities working with the NHF and the ministry have clear instructions that our frontline staff must not work without getting adequate support in terms of personal protective equipment. And if the member knows of any case where that is a problem, I'd certainly like to know about it. Thank you, Mr. Speaker.
Mr. Arscott, could you give way to Ms. Hannah, who has been trying to make... I had recognized you previously, but ladies before gentlemen.
Minister, is there a protocol that does not allow private citizens to administer their own testing? So, for example, if companies wanted to bring in tests, are they prevented from doing so? If they are prevented, why is this the case? And the follow-up question to that is, if they are not prevented, is there a protocol that they can use to buy the test that is there? But is it a centralized national policy that it is only the Ministry of Health that is to test?
So, Mr. Speaker, that's a good question. I've gotten it a couple of times. The current arrangement is that the government of Jamaica, through the public health system, manages testing. And to date, no permission has been granted to any private entity to either import or to administer COVID tests. And there's a reason for that, Mr. Speaker, quickly. That is the concern by public health that in the very early stages of the virus, when epidemiologically you want to understand the features of the virus, you want to understand and be in control of the data around testing, both in terms of its geographic spread, but the profile of individuals, impact, that mechanism for monitoring and for drawing conclusions around how the virus is operating within our society is best done when you have the control of, among other things, testing. That is not to say over time that will not change, but right now the labs that are certified for using the testing, the PCR testing, are a total of 2, University of the West Indies and the Public Health Lab. And that is the mechanism that we're using as of now. But that could change in the future.
Mr. Oscar.
Thank you very much, Mr. Speaker. First question, Minister. Minister, the first question is, you said all hospitals have a COVID ward. And I speak on my behalf as well as a member from Southeast Clarendon. The Lionel Town Hospital that has the first COVID death in Jamaica to date has no COVID ward. In fact, they have a facility, probably 2 basins and a toilet or 2 could establish a COVID ward. We hear arguments from health professionals there that 40 million is required for a COVID ward for Lionel Town. But if you know the terrain, the entire Veer area, this is a large area with many, many persons. And I'm saying there's absolutely no reason why you don't have a COVID ward in the hospital that had the first death in Jamaica. The second question I have, Minister, I would like to hear it from you. It's really on testing too. What percent of the Jamaican population has been tested to date? And the third point I want to find out from you, what is happening at the national arena and that expenditure there after we have overcome the COVID cycle? What plans are there for that facility? Or would it be better to have put the investment at some place where later on it could be utilized as part of our health program?
Mr. Speaker, very quickly, the Lionel Town Hospital is an outlier in the COVID preparation, partly because it's a very small facility. It serves an important purpose to that side of the population, but the Maypen Hospital, as you know, is the primary hospital in the parish, and Maypen Hospital has made appropriate provisions, Mr. Speaker, to cover the parish of Clarendon. And so that would be the response. It may not be economical to spend that money to establish a COVID ward, even though I will have to check with the region to see if there are any plans, but as of now, I know of none. But where the investments are is at Maypen Hospital. As it relates to testing and the percentage of the population, I think that's there, the data. It's I think it's just under 9,000 now. We just need to work that out in terms of the percentage. Remember, I say again, it's not about the numbers, it's about the approach. I won't dwell on that, but there is a specific approach to testing. And then the final question you asked about the expenditure, the proposed expenditure for the National Arena, setting up a field hospital. Part of the challenge that we face is that we really don't know how much challenges we will face going forward, despite our attempts at preparing when the economy opens up, when people start to move in and out. And a lot of the facilities that we now have, the hospital facilities, are already stretched based on just the normal course of servicing. Plus, the extra facilities that we have gotten, many of them are hotels, and they are going to want to go back to normal activities. And so you're going to lose a lot of capacity when you get into the normal flow, and the limitations of your existing infrastructure does create a challenge, because you're really not sure whether you're going to be overburdened by a surge in cases. So I really can't say with certainty that if we establish this field hospital, we're going to use it to its maximum capacity. The issue is whether you want to err on the side of caution and prepare and maybe not use it the way it could be used, or not prepare and then be in a situation where you have persons waiting on the outside of A&Es and not be having a bed to get service. It's a difficult decision, and it can be interpreted either way, but we are thinking in a way that puts us in a position to best be able to respond. Now, the expenditure on that facility, as I understand it, is both to retrofit and create these wards, or cubicles, but also to equip. So the equipment would be repurposed once we have no need for the facility. And that is something that I've asked the persons managing the project to look at to see what that spread would be. If there's an alternative course that would mean longer term benefits, then I'd be more than prepared to look at that option, and I've said as much to them. Thank you.
Mr. Stewart, and then Mr. Bunting, and then Dr. Phillips.
Thank you, Mr. Speaker. Honorable Minister, you mentioned the strengthening of systems in 8 areas. Number 4 speaks to points of entry. We have seen recently where an individual who came into Norman Manley was whisked away without following due process based on what the other 44 persons who came in on the plane had to undergo. Will everyone who comes through our points of entry be subjected to the same protocol going forward? And what measures will be put in place to monitor our unofficial points of entry that we have, separate and apart from Norman Manley, our ports there, and Sangsters? Because there are a number of unofficial entry points in the country that we know that persons coming from time to time. What will be done in this regard?
Mr. Speaker, I don't know that anyone has just come into the country and was just taken away without any justification or explanation or any procedure being followed. So I want to just say to the member that we must be careful that we do not make those claims unless we have absolute evidence on this issue. I mean, there are procedures that governs different categories of individuals coming into the island. So the diplomatic community is treated a particular way, and that is standard procedure, not just applying to Jamaica or any particular individual, but the position that that individual holds. And then, of course, there are our locals, Jamaicans, and they are subjected to another type of procedure. We will reinforce those procedures and review them as we go along. The truth is, a critical part of the protocol is sea and airport protocols. And those are being worked through now because we're going to have to relax some of those requirements to make it easier. But nevertheless, we still have to have some procedures and systems in place to manage and monitor the possibility of carriers of the virus. So, you know, there may be more stringent measures as it relates to temperature checks, for example, as a case in point. But those protocols are a work in progress as we speak. And as it relates to our informal ports, or unofficial ports, again, we have to do that in collaboration with the constabulary and the JDF. They currently manage our seaports, and they will have a role there, and we work together on that, on general policing of the borders from a health perspective, separate and apart from all the other security concerns that will be there.
Mr. Bunting.
Thank you, Mr. Speaker. Mr. Minister, I have 3 questions, but in a sense, all 3 points to what appears to be mixed signals coming from the government on our state, on what state we are in as regarding the COVID challenge facing us. So the first one, you said it will take about 2 weeks to process this 1,044 Jamaicans on the cruise ship that's at Falmouth Pier now. But we understand that there are another 4,000, well, there are thousands more, both seafarers and Jamaicans waiting to return to Jamaica. At this rate, it will take us months to process them, our own Jamaicans. But yet at the same time, the Prime Minister is saying that we're planning for reopening of Jamaica to tourists, etc. This seems contradictory. If we're planning, even in a month's time, to be reopening to tourists or to general visitors, then we must have the capacity to process thousands at a time, not 1,000 taking 2 weeks to be processed. So the first question is, when do you anticipate that you will be able to process even those Jamaicans who are on cruise ships now, when you will be able to complete receiving those Jamaicans? That's the first question. Second point, the Prime Minister said that when the work from home order expires at the end of the month, which is not this weekend but the following weekend, it will not be renewed. And we have seen easing of the restrictions on churches, bars, etc. We know there's not a single COVID patient in hospital for treatment now. There may be for isolation, but not for treatment. For the last couple of days, I don't know, you didn't tell us what today's status is, but for the last couple of days there have been no new cases, and the cases that we have had for the last 2 days have been primarily the ones that were imported. But yet, for this weekend, you're putting on a more severe curfew for the long weekend. From 3 p.m., I think, back to 8 a.m. This is the same curfew you applied when we were having the outbreak in the workplace cluster, and it seemed justified at the time. But when we're moving in the other direction and we don't seem to have that, what justifies this restriction? Right? I never asked you the question. and at the same time, we're planning to reopen for tourists. And Minister, the third question. The third question, you made a point that in the living with COVID era, it is very important to not stigmatize those who have been infected. But yet at the same time, Minister Chang is talking about letting them loose on the population and stigmatizing these people. So we are sending mixed signals consistently in all these areas. Minister, could you please respond to this and apologize to those 1,044 people?
Dr. Ferguson. Members, please pose your question relevant to the statement by the minister, and ask the minister again to answer question relevant to his presentation. New evidence, news presentations are not permitted at this stage. The minister made a statement, question must be relevant to that statement. Anything new, he has no obligation to answer. Dr. Ferguson.
Mr. Speaker, he has yielded to me.
Mr. Twait, I recognize Dr. Ferguson and Dr. Burke before you came back in, and you next.
The Speaker may wish to yield.
Mr. Speaker, to the Minister. Minister, about 5 weeks ago, you announced, or it could even be longer, that you would have started the antibody testing. Today, you have again announced that the antibody testing will begin. Direct question, when will we start antibody testing? Secondly, Mr. Speaker, as it relates to you have reported, that 41 new ICU beds and 32 new ventilators. Exactly, Minister, how many ICU beds do we now have? One. And secondly, how many ventilators have we commissioned? Now that you have added 32 and you have added 41, we just need to know how many ICU beds the country now has, how many ventilators the country now has. And the final question, in relation to the budget, Minister, in the supplementary budget, the minister spoke about $6 additional billion. Can you allow the minister to listen? The minister spoke about $6 billion additional in the supplementary budget. But I noticed also that there's a $2 billion that has been taken away from health. How much exactly is the COVID budget at the end of the supplementary debate?
Dr. Burke. Dr. Burke, if you're not, you're yielding to okay. And then we have two other questions. Remember, it is 4:37. Mr. Thwaites?
Mr. Speaker, will the minister confirm that...
Order, please.
Will the minister confirm that Jamaicans returning to the country
are subject to quarantine for a period of 14 days. Consistency demands that the same would be required for visitors as well. Will the Minister confirm that all persons coming into Jamaica, there will be no differential between whether you are local or whether you are a tourist?
Mr. Speaker, a number of questions. The member from Central Manchester, Mr. Speaker, asked the question, and you're right, all three are related in some way, shape, or form. The issue around workplace order being lifted, tightening of restrictions, and the loosening of restrictions, then tightening for the weekend, the holiday weekend, and comparing that with the fact that we're doing well. So I'm happy that the member has agreed that we are doing well as it relates to the number of cases and the management and treatment of cases. But what the member is failing to do, and I'd ask him to look at that and rethink his assessment of the situation, is that we're doing well for the very reasons that you are critical of, in that it is the measures that we put in place that has caused us to do well. And the management of that process does require at times, as in other jurisdictions, for us to loosen sometimes and tighten other times. Loosen some areas, tighten some areas. That's why we have quarantining of communities. That is why we have quarantining of communities, because when a community is assessed as being at risk, then you move in without affecting the rest of the population. So the weekend activity, the weekend in the eyes of the public health team, of course, in deliberations too with the cabinet ultimately makes a decision. The holiday weekend does provide an opportunity for greater spread of the virus, if the virus is present in a particular population, because of the propensity for persons to gather together to do the merrymaking and the celebrating. And frankly speaking, the government wants to discourage it this particular weekend because you do not want to create an opportunity for spread where you can avoid it. That is not incompatible with a general movement towards opening up the economy for persons to go back to work. And so the Prime Minister and I are not at odds as it relates to that. It is a very coordinated approach that is well thought out and that has levers to move and adjust in order to manage the process. Bear in mind, member, that Jamaica is one of perhaps very few countries in the world that has not shut down its economy totally while managing this COVID challenge. Other countries have totally shut down. And frankly speaking, that is something worth celebrating. What we have actually done is engage the process of contact tracing, of managing the process, and only intervening with extreme measures where it is necessary. And that is what continues, and that is what accounts for all the issues that you have mentioned. So I think that takes care of the questions that you have asked. The other member from St. Thomas.
No, with respect, Minister. I asked if it's taking you 2 weeks to process 1,000. Okay, how long will it take us to bring home the rest of the seafarers?
And I will answer you again in the same approach, member. The management of this very unusual event or series of events does require a learning curve. It requires our capacities to adjust, to recalibrate, and to respond in a particular way. When we announced the opening of bars, we announced a 2-week probationary period to study, to understand, and then to move to the next level. The fact that we are now taking 2 weeks to process 1,044 Jamaicans from a vessel does not mean, member, that it's going to take us 2 months to process an equivalent number proportionally over that time. Because our capacities are improving. I just said that we're hiring more people. We're actively hiring more people. I've also said in the past that we are engaging more technology to manage persons, that we're going to be shifting from institutional quarantining to home quarantining. All combined will ensure a much more efficient process in this new norm that I speak of, where we will be able to move much speedier while at the same time mitigating against the risk. And so it will get better. It will get better. On the issue, it will get better. It will get better. Mr. Speaker, I'll allow the member to respond to you. I'm sure he meant nothing by it. I'm sure he was referring to the virus, not to individuals. And that is fair game. It's the virus that we're fighting, not any individual. And we are against discrimination. Mr. Speaker, as it relates to the member from St. Thomas, he asked some very specific questions, and I really just don't have the answers. You're asking me about the numbers of beds and ventilators. I may have those answers. Okay, let me tell you. Hold on. We have 28 at UWI, 4 at Cornwall, 5 at St. Anne's Bay, 2 at Victoria Jubilee Hospital, 5 at the National Chest Hospital, and 4 in Mandeville. So that would be the total number of ICU beds that we have in the system. And 3 at Buster Manty Hospital. In terms of, and we're getting the additional capacity because we're trying to get up to a minimum number based on the modeling of when we think we will have our peak demand based on how we think the virus will spread over time. The staff, remember now, we brought in 200 Cubans who have been deployed. No, they are experts. We have a long history, you know that, and I'm sure you support. And they have added significant capacity, particularly as it relates to specialist care and care in ICU settings. So yes, we'll have that. In terms of the budget, member, I am told that we're budgeting about 6 billion or thereabouts, give or take. It changes because it's a dynamic process. So that's the number that I have been given. And in terms of the ventilators, I'm told that 29 have been commissioned to date. Remember now, we had about 25 in the system before, so an additional 29. We're trying to get up to about 80 or so. The final question, Mr. Speaker, was, what was the question, member from Central Kingston?
If Jamaicans are being quarantined for 2 weeks, how long will the tourists be quarantined for?
Right. So, as again the member would know, there is no tourists currently coming into the island, and the protocols that are now being considered will not only address the tourism industry, but it clearly will have to address the thousands of Jamaicans who are waiting to come back to their country, who we want back in our country, and certainly we will make appropriate provisions so it will not be a case of discriminating against one over the other. Certainly our Jamaicans have the first obligation to accessing their country, and that is being dealt with, as is now evidence with some of the organized entries that we have had, including the most recent.
No,
members.
The question of the antibody testing.
No, Dr. Ferguson.
No, you didn't answer the question
Dr.
on
Ferguson,
antibody testing,
please.
Minister.
We've been on this question 1 hour and 45 minutes.
Mr. Speaker,
I'm going to ask,
I asked the question, when will the antibody testing begin?
Take a note.
Especially against the fact
take a note
I don't
of
want
the 3 first questions, and you get up and answer them one.
You'll answer, especially with
Dr.
the
Ferguson,
reopening of the
Mr.
economy.
Hilton,
Especially with the reopening
and
of
Dr.
the
Burke.
economy.
That's it. Questions? Mr. Hilton, ask your question.
Thank you, Speaker. Minister, the question, I listened to the answer to the question on the disposal of the bodies. I was not satisfied the manner in which that question was responded to. Let me ask you the question in this way. Is there a public health interest in the disposal of bodies? Your answer suggests there is. And if there is, then it can't be just information for funeral homes. It should be a publicly disseminated information. Where can we find that the public, whomever is interested, where can we find that information?
Dr. Burke.
Permission to speak from a seat other than my own? Mr. Speaker? permission to speak from a seat other than my own? I'm assuming that I have it. Minister, I was really wanting to ask a few questions. You spoke of phases that you have been talking in terms of, I don't know if you have the details yet, but in terms of what is being discussed, as you said, from the collaboration of the private sector unions and all of that, I am wondering about what is some of the thinking around making sure that individuals, especially in the vulnerable community, are not left to the mercy of business operators as we open, especially because we're asking people who are vulnerable to stay home, and at the same time we're asking at the end of the month for people to come out to work. How do we protect those vulnerable citizens who would have a need to actually work from home? What is the thinking behind that? Also, as we move towards reopening, again, it's come back to the issue of testing. Everything suggests aggressive testing. In this new phase, what would aggressive testing look like as different from the kind of testing that we have been doing before?
Dr. Tufton, please complete your answer.
Yes, Mr. Speaker. In terms of the antibody testing, I recall saying that the process to engage in antibody testing has commenced. So yes, it may have been a few weeks ago, but I don't recall signaling that we would start on a particular date. Part of the process I had explained at the time, remember, was that there needed to be an examination of the types of tests that were available, because not all of the tests available had the accuracy. And so we actually set up a small committee that actually reviewed a number of tests that were on the market. Yes, and that took some time, and then we narrowed it down to a few, and then we have ordered some quantities, and I am told that there is going to be a validation exercise that will still need to be done in order to settle on a particular antibody test. So it's a process, that's the point I'm making. But we have recognized the value of it, and we are pursuing it, and that will happen. That will happen in due course. In terms of the issue of bodies, I'm told that the protocols are on the website of the ministry, but so you can access the information there. But I hear you in terms of the general populace being aware. The idea, of course, no, I'm not. The idea, of course, was that the funeral homes, who essentially manages the funerals and the management of bodies, that they would provide that information to those who would participate. But we can always provide additional information if necessary. In terms of the issues around recovery, you're right. I mean, we're still in a pandemic phase. That's a declared position by the World Health Organization. So, and that's where we are. Having said that, the idea of managing that phase in order to ensure that we also manage our economic recovery is also important, and countries all over the world are contending with that. And so there are some things that we have to do, including some of the concerns you have raised about vulnerable communities. That's part of the new phase, which is how do you establish the protocols around workplace interaction, around testing, around sanitation, what is provided for employees. That those are questions that have to be addressed, and that is what we're working on now. In fact, I chair the Resilient Committee, which is a subcommittee of the Economic Recovery Program, which includes private sector leaders, the unions, and others. And part of the role of public health is to bring the protocols around public health activity within the overall plan. And the idea there is to try and restore normality while still being cautious. The recovery phase, to my mind, will only come when modern medicine catches up with the virus. So whether it's a vaccine or otherwise, but when you know you have a response to the virus that is going to mitigate against the fatalities that are now the case because there is no known response or tried and tested response. I think, finally, Mr. Speaker, on the PPEs, I've said so much about that. I can't say with certainty how many we have in stock today at another place. And I have committed to get the agency with responsibility for procurement to come to the next meeting to provide you with some better specifics. So I'm going to ask you kindly to await that discussion, and I'm sure you'll be satisfied at the end of that discussion. Thank you, Mr. Speaker.
Announcements.
No, there's one question that's still left. No, there's a question that's still left unanswered. Minister, it is around the question again about masks, about removal of GCT, and about standards and guidelines.
Announcements.
No, on a point of order, I am pointing out, Mr. Speaker, that the minister had
in this
omitted.
Parliament long enough to know that you must recognize the Speaker when you want to speak. We cannot stop you, but must recognize, and I will deal with you.
I thought that's what I was. I thought I was doing that, sir.
You have asked your question already?
But the question has not been answered.
No,
I'm not asking a new question. The question has not been answered.
The Speaker, can I assist the process? The member asked the minister a question, but the question, so she's awaiting the answer now.
With that intervention, go ahead, Dr. Burke. And you may speak from where you are.
Thank you very much. Minister, the question around the mask, removal of GCT, and the standards and guidelines around masks.
Mr. Speaker, I can't speak to the financing issue around mask taxation issues. I'll certainly reference that to the Minister of Finance, who has that primary responsibility. But what I will say is that we have outline guidelines. We actually sent out a formal release around masks, the wearing of masks, how it should be removed and placed on the face. I must admit, Mr. Speaker, that I've seen a bastardization of the proper use of masks, even in this very house. I mean, member there from South Manchester is giving us a good example of how not to wear a mask. And so is a member from Central Kingston. But Mr. Speaker, we have also engaged in public education programs, and we will continue so to do. Because the reality is, if the improper use of masks or wearing of masks can be as dangerous as wearing none, and we certainly would encourage persons to follow the appropriate protocol. Thank you, Mr. Speaker.
Announcements.
Mr. Speaker, permission to speak from a seat other than my own.
What did you say?
Mr. Speaker, just to bring Parliament up to date on the matter in relation to Indicom. Members will recall, or some members will recall, in the last administration, a Joint Select Committee was set up to consider the Indicom Bill Act. We met 23 times, and a report was prepared. It was passed in the Senate and tabled in this House sometime in October 2015. The election intervened, and this new Parliament was elected. And around the same time, the full court gave its decision in relation to the prosecutorial role of Indicom. But at the same time, the Police Federation appealed the decision. So, as Minister of Justice, I decided that the report, which was tabled in 2015, but that we would not deal with it until the court actually came to its final decision. The Court of Appeal gave its decision in 2018, and Indicom appealed, and the Privy Council gave its decision on the 4th of May. Mr. Speaker, the position is that I propose to bring next week a motion to bring the proposal, the recommendation of the Joint Select Committee by way of motion to this Parliament so that we can debate the bill and come to some final position. Well, the report, sorry. The report so we can debate the recommendations.
Thank you. You.
Yeah, Mr. Speaker. If
Go
I
ahead.
may.
Mr. Golden.
Thank you, Mr. Speaker. Minister, thank you for that update. As you know, I chaired that Joint Select Committee. It's been a long time since that report was finalized, and I hear the reasons why you've delayed dealing with it, but I'm glad now that the Privy Council case is complete, we can actually move forward with it. So I look forward to the debate on that report, Minister. Thank you.
Mr. Chubb.
We hope, as I indicated, to bring a motion to deal with all the recommendations in the motion next week.
Announcements.
Laid on the table of the House today are the following. Annual report of the National Products Limited NPL for the year 2018-2019. National Housing Trust Housing Benefits Silver Sun Housing Development Order 2020 under the National Housing Trust Act. National Housing Trust Housing Benefits Ruthven Towers Housing Development Order 2020 under the National Housing Trust Act.
Bills brought from the Senate. Petitions. Reports from committees. Notices of motion given orally.
Mr. Speaker.
Mr. Whittle.
Yes. Thank you, Mr. Speaker. I beg to give notice that at the next meeting of the House, I will move the following motions. 1, be resolved that the National Housing Trust Housing Benefit Silver Sun Housing Development Order 2020 under the National Housing Trust Act, which was laid on the table of the House on the 19th day of May 2020, be referred to the Regulations Committee of the House of Representatives for consideration and report. 2, be it resolved that the National Housing Trust Housing Benefit Ruthven Towers Housing Development Order 2020 under the National Housing Trust Act, which was laid on the table of the House on the 19th day of May 2020, be referred to the Regulations Committee of the House of Representatives for consideration and report. Mr. Speaker, I further beg to give notice that at a later stage today I will move for the suspension of standing orders to enable me to take these motions.
Questions and answers to questions. Motions for leave to introduce bills. Presentation of bills without leave of the House first obtained. Public business.
Mr. Speaker, I now ask for the suspension of standing orders to enable me to take the motions, notice of which I gave earlier.
Those in favor? Those against? Members. There's a resolution on the floor. Those in favor? Those against? Yes, have it.
Mr. Speaker, I now move that the motion, notice of which I gave earlier, be approved.
Those in favor? We have 2 motions on the floor. You want to put them one time?
We'll put them together, Mr. Speaker.
Number 1, those in favor?
They were put together already, so I ask that both be
Those in favor?
approved.
Those against? As I proceed.
Thank you, Mr. Speaker.
So
we now have they closed the debate on the Data Protection Act 2020.
Thank you, Mr. Speaker. Mr. Speaker, we on this side of the aisle support and commend the passage of the Data Protection Act. This legislation is critical in defining the rights of data owners, who and how their data can be accessed and utilized, and the penalties and fines for the abuse and misuse of their data. Mr. Speaker, I want to speak about data protection within the context of the government's CARE program and to highlight how it is applicable. Since the advent of COVID-19, the government of Jamaica has launched a program to assist individuals and businesses who have been adversely affected as a result of the downturn in our economy. Close to 500,000 Jamaicans have applied to the government for assistance under the CARE program. In completing their applications, they have submitted personal information such as their name, address, occupation, telephone number, email addresses, places of work, etc. Under the Data Protection Act, this data is owned by the person who has submitted it and can only be used for the purpose for which it was collected. And I want to highlight Section 25, Clause 1, and I'm reading from the Act. The bill. The second standard is that personal data shall be obtained only for one or more specified and lawful purposes and shall not be further processed in any manner incompatible with those purposes. It would be an offense under the Data Protection Act to share this data with a third party without the consent of the data subject, and for the data to be used for any other purpose other than which it was collected. And I would again highlight Section 24D, Clause 4 of the Act, which says it does not involve disclosure of the personal data to a third party without the consent of the data subject. So in other words, if I have submitted my data to the government for an application for a COVID grant, I own that data. That data cannot be shared with any other third party, and if it is to be shared, I would have to give consent. If it is shared without my permission, the person who did that commits an offense under the Data Protection Act. Section 24K, subclause 6. For the avoidance of doubt, a data subject may at any time withdraw consent to the processing of any sensitive personal data in respect of that data subject. In other words, again, if I feel as the data subject that I have a concern about how my data is being treated, I can formally indicate that my data should not be processed or shared with anybody. Mr. Speaker, the second feature of the legislation that I want to speak to relates to the establishment of an oversight committee which will hold the Information Commissioner accountable. The Information Commissioner has tremendous powers, will become one of the most powerful civil servants, can initiate investigations, can impose penalties and fines. And the committee felt it was important to have an oversight body that would hold the Information Commissioner accountable. While the Information Commissioner reports to Parliament, we have found that many of the parliamentary oversight committees have not been effective in holding these commissions of Parliament accountable. So the Data Protection Oversight Committee will be established by the persons would be appointed by the Governor General upon recommendations by the Prime Minister after consultation with the Leader of the Opposition. It would be comprised of a retired judge of the Supreme Court, an attorney with expertise in data protection, and 4 other persons. The importance of this, Mr. Speaker, is that we have seen in other commissions of Parliament where individuals have been allowed to go off on a frolic of their own. And I believe the establishment of this oversight committee is a step in ensuring that while we want independence for an information commissioner, there are appropriate safeguards to hold that individual accountable. The other feature of the legislation is that we have agreed to a 7-year appointment for the information commissioner, which would ensure that the person is not subjected to the typical 5-year term of a period of government. So that person should feel more secure that they can execute their responsibilities without the fear of offending a particular administration. And that 7-year period would go across administrations. Mr. Speaker, the other area that I want to highlight, a feature of the Data Protection Act, relates to consent for direct marketing. And I call it opting in versus opting out. Consent for direct marketing. So a requirement is that an individual has to explicitly consent to become the recipient of direct marketing programs. So let me give an example, and this is one which I think many Jamaicans can relate to. You go to an entity and you want to access free Wi-Fi. And they ask you for to access the free Wi-Fi, you have to put in your email address. And then so soon after you have done that, you get bombarded with all kinds of things because somebody has taken your email address, shared it with a third party, and now you become the recipient of all these direct marketing programs. So under the Data Protection Act, the individual would be required to explicitly consent. So in other words, you have to opt in versus in many cases where you either are not told or where you have to opt out. And I will read the specific Act, Section 10(1). A data controller shall not process personal data of a data subject for the purpose of direct marketing unless the data subject A, consents to the processing for that purpose, or B, is the subject to subsection 4, a customer of the data controller. Mr. Speaker, that will protect many Jamaicans, and we have gotten a lot of complaints, some from persons who are customers of telecoms companies, that they get all of these promotions, they don't know where they come from. This protects our customers. Mr. Speaker, I want to turn to data protection and NIDS. One of the issues that arose in the Supreme Court's ruling on NIDS was the absence of data protection legislation. And while it wasn't explicitly stated, the promulgation of data protection legislation is an important prerequisite to the passing of any new NIDS legislation. And I quote from one section of the court's ruling, and this is paragraph 80, and I'm quoting: misuse and abuse of data in many instances are either accidentally uncovered or made known by a whistleblower. And in rare instances, the misuser does something with the data that causes the alert ones among us to know that that particular misuse could only have occurred because there was access to the data. This is why there must be robust systems that minimize data theft. The punishment for data misuse and abuse must be such that there's a strong deterrent element in the data protection regime. The old saying, prevention is better than cure, applies in the context of data protection. As we contemplate a new NIDS, we must be guided by provisions in our new Data Protection Act. And I want to quote Section 26. The third standard is that personal data shall be adequate, relevant, and limited to what is necessary for the purpose for which they are processed. In other words, if it is a national ID, you don't need to know somebody's blood type, the financial information, your thumbprint, your toe print. You only need to collect the data that is important for the production of a national ID. And the Data Protection Act explicitly states that in Section 26. Mr. Speaker, I want to turn to a recommendation to the government. One of the most effective ways to ensure that this Data Protection Act is implemented well is for all citizens to know what their rights are under the Act. I'm therefore calling on the government, and specifically MSET, to implement an aggressive public education campaign to inform the public of their rights under this legislation. Concurrently, institutions need to be aware of what their obligations are and what their requirements are under the Act. So there's a need to build and develop capacity in these institutions, in particular in what I would call the small and medium-sized institutions. We got some estimates about the cost of implementing this regime for financial institutions, and it ranged from $25,000 up to $1 million. In fact, it may have been US, actually. Now, for this legislation to be successful, we have to ensure that all institutions, large and small, not just know what the requirements of the Act are, but are in a position to implement it. And that is going to require significant capacity building and also a cultural shift. And this is going to be the big part. The cultural shift to understanding that data subjects own their data and that they have rights, and that those rights must be protected, and we have put in place legislation to do so. Mr. Speaker, in closing, I want to commend the current minister, the member from Eastern St. Andrew, for her dedication and commitment to getting the work of the committee done. I have to highlight she's the third minister in this administration to oversee this portfolio. And this committee had no meetings for a period of 1 year and 3 months, from March 2018 to June 2019. But in fairness to the minister, once she assumed chairmanship of the committee, we had meetings almost on a weekly basis. She was diligent in dealing and dispatching the matters, and I believe she must be commended for moving the legislation through. I also want to commend the technical team, and I see in the Parliament, Joaquin Murray from MSTEM, Cadian Smith, the Chief Parliamentary Counsel is here, the Solicitor General and the team from the Attorney General's Department, the Legal Reform Department, and all the other civil servants who painstakingly worked hard to bring the Act to where it is right now. I also want to commend the many stakeholder groups who made contributions, written and oral submissions, took the time to read the legislation and commented on it. And Mr. Speaker, I would tell you the lesson from this is that the parliamentary process of utilizing joint select committees work. The bill, what was brought in at the beginning and where we are now are two different things. And it has benefited from the contribution of members of the committee from both sides, from the technical team, and from civil society. And in my final closing comment, the Prime Minister has said he intends to fast-track the new NIDS legislation. We have to ensure, and we are going to hold the Prime Minister to his word, that this legislation will be subject to a joint select committee so that it can go through the rigor that this Data Protection Act went through to ensure the broadest based consultation and participation, and to ensure that we have an act which meets the requirements of all Jamaicans. Thank you, Mr. Speaker.
Miss? I think I drew first. Mr. Speaker, I also stand in support of this bill, and I also would like to commend the Minister for the hard work that she's done. Again, just like the member said, showing up every week and making sure we're here to get this bill on the way. There are so many reasons, Mr. Speaker, at this time prompting us to move. with the times and protect the privacy of our citizens. This data protection bill will change many things, especially what we see happening with this pandemic. Data has been collected for processing, health information and various reasons for the COVID-19. And more than ever, I believe government must now make sure that their citizens' data is protected from fraud, theft, and other things. So this bill, of course, is of utmost importance. Just a few months ago, I believe we heard of some data breaches. And because of this, consumers, I think, are more aware and concerned about how their data is used and collected. So, Mr. Speaker, I am comforted knowing that the reporting mechanism embedded in this law to publicize breaches will protect our citizens. So I'm happy to say that I was a part of this select committee. Actually, this is actually the first bill going through as a new member of this parliament and seeing it to the end. Because many people really don't know why we're here as members of parliament. But we are here really to pass laws and to make sure that our citizens are protected. So I'm very happy that I was a part of such an important piece of legislation. Mr. Speaker, I believe the members, the technical team, we have to commend them also, the technical team, for the work that they've done. The team listened to the many concerns from the different companies, the different groups, individuals who came and made their submission. And so we have to also thank them for their input, so that the technical team could actually frame the law to achieve the best piece of legislation at this time. And I believe that was achieved. This data protection bill is very important on many levels, as I said, especially in this new normal. So I am looking forward to the passage of this bill. Thank you.
Mr. Paulwell.
Thank you very much, Mr. Speaker. I will be very brief, as my colleague from Southeast St. Andrew has contextualized much of the aims of this bill, and dealt with some of the areas, most of the areas that I had wanted to touch on. Let me also share in the commendations to the government for getting us to this point. We have been at pains to argue, and as somebody who was involved in the litigation in the NIDS case, my law firm that is, we had warned about proceeding with NIDS before there was this consolidation of rights in personal data being properly before us in the form of this statute. So now that it is here, and we expect that it will be passed at both houses, then I think it is now appropriate for us to get back to that issue of national identification and the regime that will administer it. But this really, the approach was putting the cart before the horse. Mr. Speaker, this represents a consolidation of sorts, because it is not true to say that your data was unprotected before now. But this really ensures that there is greater focus, that there is certainty in relation to how people use and or abuse data. And I really want to highlight the example given by my colleague, especially as we are dealing with this COVID-19 epidemic, because a lot of personal data is being collected. And we have to warn, especially our public officers, that this law will be harsh in its treatment to you if you breach any of its provisions. The law is utilizing the criminal jurisdiction to effect redress. And, Mr. Speaker, I want to suggest, and I combed through it just now and I didn't see it, but I do believe that there is indeed value in each person's data, tremendous value. And I'm going to propose that we look at the possibility of each person having a private right of action. So that if my data is abused in any way, is shared without my information, I must be able to have an originating private right of action to sue anybody, private business, or even the government, as we were able to legislate in the Fair Competition Act, to recover damages for such abuses. I think that will ensure that our citizens treat with the matter far more carefully, and that they will see that they will have power within themselves to advance and to secure damages for persons who breach and abuse their data. I support this bill.
Thank you, Mr. Speaker. Mr. Speaker, I also want to commend the Minister for the approach she took to getting this particular bill back on track. It had languished for well over a year after the demise of the previous minister, and we really didn't know what was going to happen to it. So when she was appointed to that post and took it very seriously, that was a refreshing and very helpful approach for her to take. And it has resulted in the report being finalized and the bill being ready to be put to the House to be passed. As the member for South East St. Andrew has already indicated, there are a lot of people who had an input in this. The members of the committee on both sides, the technical team from the public sector who was there, the stalwarts who carry legislation forward in this country, and indeed many stakeholders from across the private sector and civil society who showed a real interest in it and provided some very useful comments which helped the legislators to clarify their thinking on some critical issues. It's inevitable that we should have legislation to protect personal data. The law of privacy, which is another route for protecting personal data, is not sufficiently developed and codified to provide a thorough regime in what is a complex area. It's complex because there are so many different interests that compete in relation to this. There's a whole question of freedom of expression and the freedom of the press and the role of media and how they use information versus the rights of the citizen to maintain their own privacy in their own data. And that is one of the several tensions within this legislation, which it seeks to balance in a way that is in the public interest. So not everything in it is going to be loved by the media, and in fact they had lobbied quite hard for certain changes to be made. And it's a sort of legislation that no doubt over time may require further adjustment, but it is inevitable that we should have something of this nature to protect the society in an era where we generate so much digital data now, with everybody, or not everybody, but many, many people having access to digital means of communication, digital means of storing information, and information in such a wide array. I mean, videos and photographs and text and other, voice notes and all these many, the myriad of ways in which data is now produced, and how easily it can be transferred and misused. And God knows we live in an era where there's tremendous misuse of information, fake information,
deliberately twisting and distorting information and using online channels, social media and other online channels to basically foster fear or confusion and so on. So legislation that deals with different aspects of that big problem is going to be more and more a feature of the landscape in which we live. And this is one particular facet, very important facet, of what I think will end up being a series of tools over time, some of which haven't been properly worked through yet, but will, I think, inevitably be introduced to give the citizen more protection in this era. Fortunately, we had the benefit of the European standard, the GPDR, I think it's called, which is a sort of the best-in-class and most modern comprehensive standard of data protection in the world. And it was promulgated a couple of years ago, after this bill was tabled, actually. And in a way, one could have argued that maybe this bill should have been withdrawn and the whole thing thought through afresh in the light of that very comprehensive and somewhat seminal legal instrument, the GDPR, generated by the EU. The government decided not to do that, but some aspects of the GPDR regime were introduced either in modified form or fairly close to what prevails in that instrument into the bill. I do have a couple of concerns about the bill, which I think I want to share. One which bothered me quite significantly in the committee was the fact that there is no threshold in it for some of the obligations, the bureaucratic obligations that it creates, registration and so on, of data controllers. Now, data controllers is a very wide concept. Anybody who controls data, who has data for anybody else, is a data controller. So any small business, a church, a school that uses a computer and has information about their customers or their flock or their congregation or their clients, they are data controllers. And the legislation is going to impose requirements on all of them, no matter how small or unsophisticated their operation may be, how tight for funds they are, and so on. They will have to comply with this legislation. And this is something which concerned me, and I raised it in the Joint Select Committee. The minister's position was one that the database of registration needs to be as complete as possible. I understand that concern, that objective, but I did feel that there needed to be some threshold, because I think it's going to be extremely difficult to get many micro operators to comply with this legislation. The second point I wanted to raise was the cost to business of compliance, especially in an era now where the economy is going through a significant contraction. And we've heard the IMF saying yesterday, apparently, that they think Jamaica's recovery won't come fully anyway until 2021, 2022. That's 2 years away. I hope they're wrong on that. But that is what they said. They said that they expect the US to start recovering next year, and the lag between the US and Jamaica recovering being about a year. So that is an ominous notion for us. But in the context of a very difficult economy, where the government itself has said in the tabling of the supplementary estimates that it's expecting a 5.1% reduction, negative growth for this year. You know, the 5 in 4 has become -5 in 4. And that's a frightening concept for all of us. Now, the implications of that, of course, are that business can't take on additional bureaucratic costs. You know, if we want businesses to survive and employment to recover and so on, we need to be careful about what bureaucratic costs we impose on businesses. And this legislation does involve some amount of bureaucratic costs to each business, where they have to have somebody responsible within the organization for the management of the obligations under the Act. And the failure to do so is a serious matter with very onerous penalties. The penalties in this legislation are extremely heavy. So I have some concerns about that. I think that we've adopted a model which I think Jamaican businesses are going to find to be somewhat onerous, and the timing of it needs to be sensitive to that. This bill will not necessarily come into effect when it's passed by the House and the Senate and gets the GG's assent, because my recollection is that there's a provision in it that allows the minister to determine what sections are brought into effect and when. The Act can be brought into effect all at once, but it can also be brought into effect at many different dates or several different dates for different aspects of the bill. So I'm hoping that it will, the government will be careful and sensitive to the impact that it will have on businesses in terms of the timing. And of course, there's going to need to be significant public education, which will also have a cost before you bring it into effect, because it's quite complex and it's quite extensive. And I think many, many people out there have no idea whatsoever of what's in it. So that there will need to be a comprehensive public education program before it is introduced into law. The last point I wanted to make concern, and this is somewhat relates to the issue raised by the member for East Kingston and Port Royal, but I'm focusing now on the international dimension of it. Much of the data that Jamaicans produce in digital form is held by massive corporations that exist outside of Jamaica. I'm talking about the Googles, the Facebooks, the Instagrams, etc., Amazon. They are where a lot of the data of Jamaicans happens to be stored, because Jamaicans use their platforms extensively, as do people all over the world. The question really arises, if a Jamaican citizen has his or her rights violated by an offshore entity who has received that data and proceeds to violate the legal rights under this Act of that data subject, as they're called, what is the recourse that the Jamaican citizen has to enforce those rights? That was something which was raised in the committee, and there was some discussion over it, and it brought into light some of the weaknesses in the international enforcement regime that Jamaicans can rely on. Many of these matters are really governed by international agreements, and they need to bring into domestic effect the international agreements that are signed. Some of Jamaica has signed some of these to do with mutual legal enforcement and assistance in legal matters in the civil sphere and the criminal sphere. But often the actual operationalization of that in terms of the jurisdictions where Jamaicans can, for example, enforce a judgment obtained here fairly easily, they're not very extensive. Many countries or states in the US, for example, where Jamaicans might want to be able to enforce their rights, we don't have a mechanism in place for achieving that. And I think this is something that the Ministry of Foreign Affairs and the Ministry of Justice need to take up, because once you're getting into the realm of trying to protect persons' privacy rights and persons' rights to their data, in a world where data is obviously in non-physical form and is often stored in places where Jamaicans can't easily access it, we need to have pay attention to the need to establish relationships and mechanisms that will allow our citizens' legal rights to be properly asserted and enforced in those jurisdictions. And I think that is work to be done. It has not yet been done. But I mention it here because I think it will be important in giving effect to this legislation, because so much of the data that is stored by Jamaicans is actually held by massive corporations in other jurisdictions. So those are some thoughts I have on this legislation, and I would just close by once again thanking the member for Eastern St. Andrew for having, to some extent, saved the day with this bill and rowed the ship back to shore. Thank you, Mr. Speaker.
Mrs. Balawu-Ford.
May it please you, Mr. Speaker. I rise to give my full support to this bill entitled An Act to Protect for the Privacy and Certain Data and for Connected Matters, which is shortly entitled the Data Protection Act 2020. Interestingly, Mr. Speaker, the origin of the act, which the Minister spoke to, came as a result of obligations imposed on member states like Jamaica, who are signatories to the Economic Partnership Agreement in 2008. And a requirement was placed on each member state to implement legislation to ensure adequate level of protection for individuals with regard to the processing of data. And this information is contained in the Memorandum of Objects and Reason. We have said publicly that this decision was taken to enact this piece of legislation in order to secure the confidentiality of personal data which may be in the possession of entities including the government, and to provide for the rights of individuals in relation to their personal data. Sometimes we promise things and persons doubt whether they are coming. It has been a long road to this place. But I really want to commend the Minister for picking up the work and going about it diligently. It has been somewhat of a process, and I want to also commend the technical team and all who have worked with it. Mr. Speaker, this is a type of law that will have to be kept under constant review and update, and perhaps with a timeliness that our law reform and lawmaking process is yet to become acquainted with. But in order for the true benefits to be derived, it will have to be kept under constant watch and review. I endorse the points made about the need for targeted public education, not only of the rights that are conferred in the law, but also in respect of the obligations. And in this regard, I just want to point out that when laws require the kind of public education that this will require, and the kind of retrofitting of government and elsewhere, usually different provisions can be brought into effect at different times. And that is exactly what this law has provided for. It will come into operation on a day appointed by the Minister by notice in the Gazette, and different days may be appointed in respect of different provisions of the Act. And I just ask the Minister, when the decision is being taken in respect of which provisions to bring in at which time, bear in mind the importance of ensuring that those who are to administer the Act really know what they are about. Because that is a challenge that I see through the lens of Attorney General, that we pass laws and persons who are supposed to implement the laws remain somewhat clueless about them. And so the full benefits are not derived and the government ends up with liability. Mr. Speaker, the privacy of data that the law centers on, the protection of that privacy, is also hinged on the privacy rights that are guaranteed in the Constitution. And specifically, everyone is guaranteed a right to respect for and protection of private and family life, and the privacy of the home, protection of privacy of other property and of communication. And if you listen to much of the talk in the public square about privacy, I've often said jokingly that there is such a fear because it is said that Jamaica is a polyamorous society. And many times when people speak about privacy rights, persons become very guarded about that aspect of it. So it is interesting to point out to persons that sensitive personal data is defined in this law, and it means personal data consisting of a number of things in respect of the person who is the data subject. Genetic data or biometric data, filiation or racial or ethnic origin, political opinion, philosophical beliefs, religious beliefs, or other beliefs of a similar nature. And we know that these are freedoms that are guaranteed in the Charter of Fundamental Rights and Freedom, the right to freedom of thought, conscience, belief, and observance of political doctrines. But it also speaks to membership in any trade union, physical or mental health or condition, the alleged commission of any offense by the data subject, or any proceedings for any offense alleged to have been committed by the data proceedings. But it has another one, which members of the public may find interesting: sex life. And in sex life, it is what brings life. It is what brings life. I view it in a particular way. So, Mr. Speaker, so in respect of sensitive personal data, in respect of personal sensitive data, there are certain conditions that have to be met before the data can be disclosed, and among them is consent in writing. And I just want to highlight it, that it is long in the making, it has come, and I believe that we will be better off in this digital age for this piece of legislation. I think most of the corrections have already been done, Madam Minister, so the rest of the process should be smooth. But I say to the Minister, with responsibility for the subject area, that it is a matter that will have to be kept under constant watch for review. But I supported the bill, and I think all Jamaicans should be celebrating that the Parliament is in fact passing this data protection law for their benefit. May it so please you.
Minister.
Thank you, Mr. Speaker. I want to thank all the members for their contribution and their endorsement of the bill. And I want to say to the member from Southeast St. Andrew that I absolutely agree with you regarding your recommendation for an aggressive public education so our citizens can understand their rights, and those who collect our data and process our data can understand their obligation. We're moving into a new regime in which our personal data ought to be thought of in the same way as we think of our physical property and the ownership, the interest that we have in that. We have to have that same ownership interest in our personal data, and to understand that it doesn't matter who generates the data about us, it is our data, and we have a right to access that data. In closing the debate, Mr. Speaker, the Data Protection Act at its core is to protect all our citizens and lays down the law about how data about our citizens can be used. In the new regime of the Data Protection Act, everyone responsible for using our personal data has to follow the law. The new law will ensure that if our personal data is used, it is used fairly, lawfully, and transparently for specified and explicit purposes, used in a way that is adequate, relevant, and limited to only what is necessary. It is accurate and, where necessary, kept up to date, and it's handled in a way that ensures appropriate security, including protection against unlawful or unauthorized processing, access, loss, destruction, or damage. In the new data protection regime, Mr. Speaker, all of us as Jamaicans will have new rights. We'll have the right to know what information the government and other organizations collect and store about us, the only exception being for national security and special purposes, which are journalism, literary, and artistic purpose. We will have the right to know how our personal data is being used. We'll have the right of access to our own personal data, and we will have the right to have incorrect personal data about us updated. Mr. Speaker, this bill has been in the making for almost 5 years, and as you've heard, there are many persons who have participated in getting us to this point where we are on the cusp of passing the Data Protection Act 2020. I wish to acknowledge them for posterity and have it recorded in Hansard. So firstly, I want to acknowledge the Joint Select Committee members who dedicated many hours to examining the bill. We have Member Juliet Cuthbert-Flynn, Member Franklin Witter, Member Julian Robinson, Member Mark Golden, Member Marissa Dalrymple Philibert, Senator, at the time, Senator the Honorable Pernell Charles, now MP Charles, Senator Matthew Samuda, Senator Carencia Morrison, Senator Donna Scott Motley, Senator Sophia Fraser Binns, and Dr. Andrew Wheatley, who chaired the first Joint Select Committee and laid the first bill. We received and heard submission, and it's worth just listing the names of all who took the time to give submissions in the process: the Information Technology Industry Council, Latin American Internet Association, Digicel Jamaica Limited, the National Consumers League of Jamaica, U.S. Chamber of Commerce, the Slash Roots Foundation and Make Better Community, the Jamaica Computer Society and the Jamaica Information Technology and Services Alliance, the Jane Bank Limited, the Jamaica Bar Association, Credit Info Jamaica Limited, Lawyers Christian Fellowship Jamaica, the Jamaica Coalition for a Healthy Society, Flow/Cable and Wireless Jamaica Limited and Columbus Communications Limited, Broadcasting Commission, Media Association Jamaica Limited, National Identification Systems Project Unit, Office of the Prime Minister, Mr. Delton Phillips, Software Development Professional, Ms. Shyster Peart, Information Governance Consultant, Mr. David Holland, Data Management Consultant, Ms. Helen Ann Elizabeth Wilkinson, Hart Murad Fata, Attorneys at Law, the Jamaica Chamber of Commerce, Jamaica Bankers Association, Press Association of Jamaica, Financial Investigations Division, Jamaica AIDS Support for Life, and Office of the Director of Public Prosecution. The technical teams that assisted in our deliberations comprise of representatives from the Ministry of Science, Energy and Technology, and I want to single out Chief Technical Director Murray and Principal Director Cadian Smith-Newton, Dr. Oliphant, and of course P.S. Palmer, who ensured that all of this happened. The Office of the Parliamentary Council, the Attorney General's Chambers, Legal Reform Department. For me, Mr. Speaker, this was government in action. I witnessed firsthand the dedication of members of the Houses of Parliament and our technical teams. Of course, we have to acknowledge as well the staff at the Parliament, Ms. Cheshan Brandon in particular, who was so diligent in taking minutes of the meetings and summarizing for us in record time so we would be ready for the next meeting. And of course, the diligent persons who record all of this on Hansard. Many times I was begging for additional time, asked them for a half an hour more, 45 minutes more, so we could get through parts of it. Just to address some of the recommendations or concern, I know Member Paulwell spoke to citizens having a private right of action to recover damages. That is something we'd have to take under advisement for any additional amendments. Yeah, the second edition. Member Golden, I note your concerns, and you also brought to bear what were some of the conclusions of those concerns when they came up. With regards to the cost to business for compliance, there's a phasing in of this, so it's not a cost that's going to land on them fully one way. And the international dimension of it, that's something that was not fully, totally dealt with in the committee that we should work on. And for the AG, your query about the different dates for bringing into action, an example of what needs to come into action first before the law could be fully brought into existence would be the Office of the Information Commissioner, because they would need to be set up to understand the law and what it is that they'd be overseeing. So, right, the office, right. So those are some of the reasons why you have different dates for bringing in different parts of the law into existence. So, Mr. Speaker, today is a watershed day. I feel honored to have been able to participate in bringing this bill to the House and ask that it be read a second time.
The question is that the bill be read a second time. Those in favor? Aye. Those against? Ayes have it.
A bill entitled An Act to Protect the Privacy of Certain Data and for Connected Matters, read a second time.
The House will now resolve itself into a committee of the whole House to consider the bill clause by clause.
Mr. Mr. Chairman, in light of the extensive discussions that the bill has been subject to through the Joint Select Committee and the contributions from both sides, I am recommending that we take the bill on hold, that's the term, on block. No?
We will put the sections and we go through, seeing that there is no amendment.
If there are no amendments,
to the report.
were there amendments?
No.
No, if there are no amendments, then what it says can go. Why?
It's not an extended exercise, so we could just go through. Yeah.
Mr. Chairman, apparently I must have been absent that day, but they apparently tabled a completely new bill embodying the amendments. So if there are no amendments, we can take it on block. Yeah.
Okay. Okay, members, I will now put the bill. No. I put clauses 1 to 4. Those in favor? Those against? Ayes have it. I put part 2, clauses 5 to 13. Those in favor? Those against? Ayes have it. I put part 3, clauses 14 to 20. Those in favor? Those against?
Ayes have it. I put Part 4, clauses 21 to 31. Those in favor? Those against? Ayes have it. I put Part 5, clauses 32 to 43. Those in favor? Those against? Ayes have it. I put Part 6, clause 44 to 55. Those in favor? Those against? Ayes have it. I put Part 7, clause 56 to 77. Those in favor? Those against? Ayes have it. I put the first schedule. Those in favor? Those against? Ayes have it. I put the second schedule. Those in favor? Those against? Ayes have it. I put the third schedule. Those in favor? Those against? Ayes have it. I put the fourth schedule. Those in favor? Those against? Ayes have it. I put the fifth schedule. Those in favor? Those against? Ayes have it. I put the title and enacting clause. Those in favor? Those against? Ayes have it. The question is that I do report the bill as having passed committee stage without amendment. Those in favor? Those against? Ayes have it. I do report the bill as having passed committee stage without amendment. Minister.
Mr. Speaker, I now ask that the bill be read a third time.
The question is that the bill be read a third time. Those in favor? Those against? Ayes have it.
A bill entitled An Act to Protect the Privacy of Certain Data and for Connected Matters read a third time and passed.
House Leader.
The Minister of National Security will now take the Dangerous Drugs Act. You know that the joint, the report on the criminal justice, the report of the Joint Select Committee of Parliament, which was set up to review and report on the Criminal Justice Suppression of Criminal Organizations Act 2014. The Minister of National Security.
Dr. Chang.
Fitzcarraldo Trelawney. Put him on the ship. Right. Mr. Speaker. If I need to ask in this new convention here, you know what the seat is. Mark. The Speaker, I now address item number 7 on the government business and the order paper, the report of the Joint Select Committee of Parliament, which was set up to review and report on the Criminal Justice Suppression of Criminal Organizations Act 2014. Mr. Speaker, as we seek to create a safe and secure and prosperous society, the pervasive presence of criminal gangs and networks in our communities, along with their criminal activities, pose a clear and imminent danger to the safety and security of the country, and therefore threatens the attainment of this vision. On a previous occasion, I would have informed the members of the Honourable House that the work of the Joint Select Committee that was mandated to review and report on the Criminal Justice Suppression of Criminal Organizations Act 2014, more popularly known as the anti-gang legislation, was well advanced. Today I'm pleased to table the report of this Joint Select Committee. Members will recall that this review was undertaken pursuant to Section 21 of the Act, which requires that a review of said Act is to be conducted by a Joint Select Review Committee of the House of Parliament not later than 3 years after its adoption. In undertaking that responsibility, the committee commenced their deliberation on October 24, 2018. A little while. And convened a total of 20 meetings. I must acknowledge and express gratitude to members of the committee, which comprise myself as chair, and members Chuck, member from North Central St. Andrew, member from West Central St. James, member from South East St. Catherine, a member from Southern St. Catherine, member from South St. Andrew, and a member from North London was appointed but attended 4 meetings and was changed for the member from Central Manchester later on. as well as Senators Ransford Braham, Charles Sinclair, Mr. Clarence Morrison, Donald Scott Motley, and Keith Knight. On the base, I want to make special mention of Mr. Mark Golding and Senator Clarence Morrison, but in particular Mr. Golding, who attended some 17 of the meetings and a valid excuse for the others he missed, and in fact made a very valiant contribution. I'd say he was critical to the completion of the work of this committee. I want to thank you. Miss 15 and Ms. Senator Clarence Morrison attended 15 of the 20 meetings respectively. Indeed, their attendance ensured we're able to make quorum on most occasions. It's also important, the AG, of course, played a critical element to deal with later on. It's also important to underscore that the deliberation of the committee and the final report benefited from the input of several stakeholder groups and important interests. The Office of the Director of Public Prosecution, the major organized crime and anti-corruption agency, the Normal Mandela School did an excellent review and gave a lot of time to it, even if many of the suggestions could not be adopted, but they did give a lot of time and brought an extensive proposal on the legislation. The Jamaica Conservative Force. All of their views were ventilated and the recommendation outlined in the report and aspects that were adopted will be indicated at a later stage. Of course, I'd like to acknowledge and thank the technical teams, and in this from the Ministry of National Security, the professional teams involved, the Attorney General Department, which played a critical role in completing the legislations, in complete the report that we could bring it here today in this manner. And the few meetings she, in fact, missed as AG, she was, in fact, well represented by the members of her chamber, who gave me considerable support in getting this review done. The Legal Reform Department, the Office of the Chief Parliamentary Counsel, and for the legal guidance and support throughout the process. I really want to express my appreciation. It was one of the first bills I've had the opportunity to review, and I found their support particularly helpful and made major contribution in getting this done. Mr. Speaker, the Anti-Gang Act makes it an offense to, among other things, engage in the following activities: forming or establishing a criminal organization, Section 3, recruiting a child or an adult into a criminal organization, Sections 4 and 5, C, being a member of a criminal organization, Section 6, leading, managing, and directing a criminal organization, Section 7, providing benefit to or gaining benefit from a criminal organization, Section 8, F, aiding and abetting criminal organization, Section 10. We seek to create a safe and secure society. The pervasive presence of the criminal gangs on networks in our communities, along with their criminal activities, pose a very clear and eminent danger to the quality of life in our communities. In Jamaica, the structure of criminal gangs are vary widely. Sometimes there are very few, maybe 3 or more, but they vary from in the strength of their network and the character of their operations and the activities they get involved in. Based on the latest assessment carried out by the National Intelligence Bureau, Jamaica still has, as of 2019, there are some 318 identifiable gangs, of which some 250 were still operational. Of the 389, I said 250 are operational. 323 of the total criminal gangs in operation are classified as first-generation gangs. The term first generation is used to describe loosely organized groups. Sometimes they're called corner groups, street corner gatherings or otherwise, which get involved in various criminal activities. These may involve simple from extortion, turf protection, drug retail, and other activities at the local level, and they operate well within the community. This, of course, sometimes poses a challenge to the police because they are members of the same community, and therefore getting evidence or getting the opportunity to convert information to evidence can be quite a challenge, because people work together in the community, and the kind of activity they're involved in is, as I said, either could be protection of the community, vigilante activity, in addition to their criminal activity. It's an area that we have to seek to address and, in fact, look at how the police orient and train and operate in these areas. The remaining 66, or some 70% of the gangs, were classified as second-generation gangs. These are the gangs that exhibit more centralized leadership, focused primarily on organized crime. And they are the ones that lead criminal organizations, the networks involving drug smuggling, gun running, extortion on a more organized scale, sometimes having their own business to which they rinse up money and get involved in transnational crime as well. There are one or two third-generation gangs which have broad reach, international access as well, and have larger numbers. In fact, it's reported that maybe some of them may even have their own legitimate business through which to rinse money in a very effective way. As I mentioned earlier, of second-generation gangs, business operations which are recognized as legitimate operations throughout, especially operations that draw heavy cash flow, and they use it to push money through. Consistent with historical trend, the corporate area continues to account for the largest number of gangs. Area 4 comprises Kingston Western, Kingston Central, Kingston Eastern, St. Andrew Central, and St. Andrew South police divisions, accounted for some 249 gangs. Some of them small, but all of them pretty violent and relatively active. Of note, Mr. Speaker, at the divisional level, 78 of the gangs identified across the island, or 20.1%, were resident with the St. Andrew South, in which the Member of Parliament has spoken very often of the challenges he faced in that area. This was followed, of course, by Kingston Central, but less, and Kingston Western police divisions. Area 5 in St. Catherine North, St. Catherine South, St. Andrew North, and St. Thomas accounts for about the second highest number with about 57 gangs, but that's a very large geographical area compared to the area of South St. Andrew. In fact, that encompasses the entire parish of St. Catherine, part of northern St. Andrew, and all of St. Thomas. And in fact, from a geographical space, St. Thomas may cover the entire St. Andrew South area. But much higher population, and we are looking to doing some work in that particular area. It's a really a challenge, and we have to, in addition to legislation, take some severe steps to interrupt the gang activity down in that South St. Andrew belt. Of course, they are followed by Area 1, St. James, Westland, and Handover, Trelawney, with some 51 gangs, which have a way of splintering and getting bigger or consolidating at different points in time. That area has some gangs which are among the more affluent, if I might use the word affluent-related gangs, because the primary activity or the base for the gangs out there for income, for all the gangs operate on a base of profit, business operation to earn money. But the Western gangs, in fact, are heavily involved in what is termed letter scamming or advanced credit fraud, which generates huge tons of cash, which is then used to maintain the gangs, buy guns, and get involved and corrupt the system. It poses a particular challenge, but the police is aware and the security forces, and we look to use some of the tools given to them by this new piece of legislation to further disrupt the gangs. Well, what it means is that the number of gangs only tend to be very volatile, because once you can scam enough money, you form your own gang. So today it is 50, tomorrow it is 60, and police disrupts it, it goes back down to 40 and goes back up to 70 very quickly. In many of the communities across the island, gang members enjoy some strong community support, which I alluded to earlier, because they are from the community. There has been a significant increase in the number of gang members identified, apprehended, and prosecuted, but even so, it's a challenge. I have never met a grandmother who doesn't say that the leader gang member is not our best grandson. That's the reality of the atmosphere operating, which poses challenge, because especially, certainly experience in that area of the island where they are involved in, involving heavily in earnings, large sums of money that actually maintains the family and maintains members of the community. And their violence tends to be between gangs rather than the community. Over the period between 2017 and 2019, however, there were some 595 gangs arrested, but of course, much of the cases were based on predicate offense rather than the anti-gang legislation. It's among the reasons why we are looking at doing amendments to bring more cases under the anti-gang legislation. In fact, we have only had 2 convictions under anti-gang legislation, but we currently have some 14 major cases in the courts and just about under 200 members of gangs who are being tried under anti-gang legislation. And we look for the impact of those, not only from the impact of the gang, but from the experience gained by the prosecutors and the police in charging individuals under the anti-gang legislation and getting them convicted. On many occasions, to disrupt, suppress, and ultimately dismantle the operations of the critical gang, the security forces target the leader of these gangs, commonly referred to as dons. More commonly used in this side of the world, but that's the general term for the gang leaders. In fact, most of them in the West are really business people, and the term is not as popular in terms of gangs out there, but it is generally regarded leaders or dons of the group, leadership of the group. Targeted efforts is also geared towards getting the guns that used to perpetrate these acts of criminality and violence in their criminal proceeds. Of course, before we get the guns, we have to disrupt. We have, in recent times, sought to place greater focus on tracking the money, because that's where the money is used to acquire guns and corrupt the system. And it has proven practically difficult to commit unless they are caught in the act or they are seen using the firearm. The guns are out there, and oftentimes the individuals you catch with the guns are the least of the apostles, so to speak. They are the shutters who have been hired to use the firearm, given the guns to by others who have it, who have the resources. So it's important to somewhat re-emphasize strategically where the money is coming from, and the resource and the source of that funding, whether it is transnational crime, extortion, or lotto scamming, and find out who controls that money. At this point in time, we have taken, you know, that the most recent commander of the Financial Investigation Division is former Deputy Commissioner Hay, who is an excellent individual, a professional of the highest caliber, quality, and integrity. And we have to find a way to find the source of the money, because in the current scenario, there are many of the leaders, the key leaders, who have distanced themselves from the street crime and therefore cannot be identified with the shooting and the killing so easily. And until we get those individuals, it will just continue, because in the conditions existing in the deep urban areas, referred to in the corporate area and part of the urban centers in the western region and the center of the island, it is pretty easy to hire a new set of young minds that are not engaged, and they get caught up in the criminal cycle, and they will pull the trigger easy, unfortunately. The other kind of activity designed to attract them and divert them, we are working on, but as I said, it is still fairly easy to find replacements when they are apprehended and sometimes killed. So there is a strategic shift to try and find those who are the organizers, the leaders, and the ones who have the funds. Part of it is not, and it is, their legitimate face provides a cover that makes it more difficult to penetrate unless you find the money and get in behind the scene. In addition to that, there are several of them who are based overseas, and we have had to seek to strengthen our links with our partners to find them, identify them, and we look in the very near future to begin to bring home some, because that's a critical element in all of this. Critical players. It's really very sad, and when, for those who know what's happening, to see how our young males are literally used by people with influence and who have money, and we end up losing cohorts of young Jamaicans. The Jamaica Cannabis Force is advanced in the process of establishing a special multi-agency anti-gang task force, which will not be a new agency, but will be using elements of CTOC, which came out of it, MOCA, which came out of an anti-gang task force, the Kingfish grouping, and working closely with the intelligence units in both the military and the police to begin, and the FID is dedicated to really identify the critical players in those who are leading our young males astray and others into getting into gang. So that we will certainly with this agency and the tools provided by the legislation, I said, have greater success at dismantling gang. Indeed, at this point in time for 2020, there has been still some reduction in the infighting between gangs. We still have a lot of guns out there, and what they're having is individuals in retaliation shooting each other. And certainly I've seen an increase in the number of guns being identified in some areas. St. James this year has gone about 50 plus firearms, and it is the work of the police in getting them. But there's much more to be done, and as I said, this piece of legislation is only a part of what is happening to ensure we can disrupt the gangs and ensure young men are directed into productive activities. The Counterterrorism and Organized Crime, Major Organized Crime Investigation branch of the JCF is working in close collaboration with the Proactive Investigation Unit at the local level for greater effectiveness in targeting the criminal gangs. We have also prioritized the resources of our border security apparatus to ensure greater effectiveness on territorial control, which deal with disrupting contraband activity, that is drugs, that is cocaine transshipment, ganja illegal trades of high THC quality, and contraband activity involving cigarettes and the kind of activity that brings huge amounts of funds to, again, the individuals who seek to organize and undermine our society. And lead astray our young males who are leaving school, sometimes a little bit misguided, and then they get caught in serious crimes. As indicated before, I said, underpinning all of this, a greater focus on financial investigations as we seek to not only pull the profit out of crime, but find the organizers and leadership who are manipulating the current situation out there. The Speaker, the committee took into consideration all of the highlighted limitations made and the recommendations made, which are outlined in the report. Some significant recommendations have been made to strengthen the Act, and they'll now be sent to after approval, will be sent to Cabinet for drafting instructions to make the required amendment. So I look forward to approval and to proceed with this to the next stage to ensure we can strengthen the anti-gang legislation. Proper title, the Criminal Justice Suppression of Criminal Organizations Act 2014. Indeed, the activities of the gang, as I said, is the greatest threat to the stability of our community. In fact, it's a constant battle. Current information is they look at every opportunity to exploit situations and strengthen their position as some kind of a Robin Hood in the inner city communities. But with expanded legislative powers, changes in the police force, and increased cooperation between all elements of the security forces, we can say there has been significant progress. There needs to be more. I think there are some, I said 13 major cases and about 155 gangsters being tried on the anti-gang legislation. Only one has gone to court for trial so far. The others have been individual cases, but the others are coming, and we expect to have the conviction required to disrupt some of these major gangs. Even where we have been able to take them to court, we still don't guarantee total disruption. Because many of the gangs, they are community-based, and you get a kind of legacy issue. Young ones come and replace them in a very short time. But we have to be consistent, pursue them vigorously, and have the police trained to focus on the critical issues, to arrest and prosecute those involved, and to begin to disrupt the activities that lend this support to the gang activities. Again, I want to thank the members for the support and look forward to the report being approved for me to take it to the next stage and have the required amendments done as quickly as possible. This stage, of course, was definitely too long. I am confident it will not take as long to bring the legislation here. All right. Thank you, Speaker.
Mr. Goldie.
Yes, thank you, Mr. Speaker. This anti-gang statute is an interesting statute. Most of the provisions are written in very simple terms. By Jamaican legislative standards, I would say it's probably the most plain English. It's an act that uses plain English probably more than any other. Very short sentences, it's extremely clear. There's one complex aspect to it, which is the definition of what a criminal organization is. And through the course of the review of the Joint Select Committee, that definition has remained intact. There are some other adjustments which have been made, mainly around the penalties and in particular aggravating factors that the court can take into account in deciding where to set a particular penalty. But the efficacy of the legislation still remains to be proved, because we have not had a completed trial through to sentence yet. There's a pending one, as I understand it, which is a major one, and that is a very important case, and we await the outcome of it. There have been convictions under the legislation, but really through guilty pleas rather than matters that have gone to trial. But there's many cases, as I understand it, in the pipeline where persons have been charged for breaches of this legislation. The phenomenon of gangs is a complex one. They're very different organizations that may be thought as falling within that rubric. I'm familiar with groups of young men who associate together for no ostensible or apparent economic motive, but because of rivalry with other groups of young men in a nearby community, or even in their own community, from the top versus the bottom, and so on. And unfortunately, especially with the links to persons from the communities who live abroad and who, for some reasons, continue to support local persons from within the communities from which they originally came, with financial support and support that leads to criminality in the form of weaponry and so on. We have a lot of violence that flows from that. Of course, that's quite different to the lucrative aspects of gang activity, which we know through the scamming and the FX trading for the money that comes into the country from the scamming and all that sort of thing, which is driven by the rewards of that economic activity. But what we see in Jamaica is that extreme violence is not always economically driven. It's sometimes driven by fear and hatred for past acts. Wrongs that have been done to friends and family, and people carry grudges for long periods of time. And incidents can occur today which have their genesis in something that took place years ago. And it's hard to understand the dynamics of some of these situations. They're very they're complicated, and they're fact-driven. And of course, in these communities, a lot of people are related as well, which also makes the relationships quite complex. But what was interesting as well in this Joint Select Committee process was a lot of the opportunity was to kind of generalize useful provisions in law enforcement that existed in other laws but didn't have general application. So they may only apply to that particular law, but there may be a need for that mechanism to apply to all law enforcement. And so a lot of the recommendations are around what I would say is strengthening the overall network of legislative provisions to support law enforcement activities. Of course, evidence gathering and intelligence are really critical aspects of this. We still have a situation where, for example, if you need to wiretap, if you need to access financial information from the banking system, if you need to track persons leaving or entering the country, it's different procedures that apply for all of those things. There's no unifying procedure where a person of interest as being involved in serious criminal activity can be the subject of a general surveillance order that gives the tracking, all of those tools of surveillance then apply to that person. I don't know whether the government is going to be looking at that, but we do have a fairly fragmented approach currently to how we deal with surveillance. Witness protection is another critical issue. And we know that funding is a major constraint there. It's expensive. Witness protection is an expensive business. But without it, you cannot really tackle organized crime because witnesses are so vulnerable and victims of victims are vulnerable. So strengthening the witness protection system is going to be very important if we're going to seriously tackle this phenomenon of organized violence in the country. The work has been done in terms of sifting through the provisions of the Act and provisions of other legislation. We had inputs from stakeholders, and now the minister needs to ride the legislative hard and get actual drafting done and a bill to amend the existing Act and with consequential amendments across many other acts to bring a cohesive whole to this. I don't know how long it will take you, Minister, to do that, but that is, given the importance, we're going through COVID now, and COVID has tended to dominate our thinking. But even in a time of COVID, with nightly curfews, all island curfews, we still have a very high rate of murders. So this situation is, a cancer that we have to grapple with, and these tools are important to enabling the successful investigation and prosecution of offenses. The collaboration between the prosecutorial arm, the DPP's office, and the law enforcement investigative bodies within the police force and the MOCA and so on, that is also really important. And we were told that earlier in the life of the legislation, the understanding of how it worked and what you needed to prove and how the evidence that you needed to bring together to successfully prosecute those cases, there was a learning curve. Obviously, the more training and the more collaboration that we can have with the prosecutors who understand the law best, guiding the investigators to ensure that the key elements of the offense, the evidence is found. That is going to be very important, because if we are able to successfully utilize this legislation, hopefully it will lead to a change in culture, and persons will be less inclined to organize themselves together to commit criminal acts. One major concern that we had was what sort of offenses ought to be possible gang offenses, because the nature of the legislation is that in its original form was that to be a gang, a criminal organization to which the Act applied, the persons coming together had to do so in order to commit serious offenses. And serious offenses there is a list in a schedule to the Act of what offenses are serious offenses for this purpose. And it's designed flexibly so that that list can be expanded without having to amend the Act. It can be expanded by ministerial order, I believe subject to affirmative resolution. So it does come to Parliament, but it's much simpler to do than to amend an Act. The decision was taken to greatly expand that list and actually to change the phrase in the Act to describe that from serious offense to relevant offense or something, because of the fact that the Act was going lower in the type of activities that a gang could engage in and fall within this legislation. So a lot of discretion is going to have to be used, I think, because it's not the intention that a few youngsters who, do a little pilfering together, non-violent pilfering of, that should be hit with prosecution under this legislation, because when you're prosecuted under this legislation, it's a serious thing you're facing. The penalties are potentially very severe. So I wasn't alone in this. I was quite concerned about that change and increasing and essentially bringing into the fold less serious offences as being potentially the subject of a gang prosecution. But the DPP's office had cited the need for it based on their experience, and the decision has been taken to do that. As I say, I hope that it is used with sensitivity and discretion, and that minor criminal activity is not dealt with through the anti-gang legislation. That is not what it was designed for. It is designed for serious criminality involving the use of violence and terror as the modus operandi. And that is one of the major national security risks that we have in the country. So, Minister, the ball is now in your court. We have bequeathed you that report, and we await the next steps for moving it forward to actually having some practical application. The Minister, the opposition spokesperson on national security is not here today, and I believe he may want, I haven't spoken to him, but I would imagine he might want to participate and make a contribution in the debate on the report. So I would ask, Minister, that you afford him that opportunity rather than close the debate on the report today, if it so pleases you. Thank you, Mr. Speaker.
Mr. Speaker, I'm asking for suspension of the debate to continue next week. The debate on the Suppression of Criminal Organizations Act 2014. I'm asking for suspension of the debate until next week.
Those in favor? Those against? As of it.
Mr. Speaker, it's not intended to do any further business for today, so I ask that the House be adjourned until next Tuesday at 2 p.m.
Adjournment. The motion is that we now adjourn until next Tuesday, 26 at 2 p.m. Those in favor? Those against? Yes, I have it. This Honorable House stands adjourned.